The hearing of the Committee on Health and Demography is hereby called to order. Before we start, let me acknowledge the physical presence of Senator Rafi Tulfo and the virtual presence of Senators Amy Marcos and Senator Coco Pimentel. Thank you for joining us. Today we will discuss updates on the implementation of Republic Act number 11036, otherwise known as the Mental Health Act. The committee will also consider the following bills on mental health: Senate Bill 920 of Senator Sani Angara, Senate Bill 1717 of Senator Amy Marcos, Senate Bill 2058 of Senator Tulfo, and Senate Bill 2062 of Senator Mark Villar. We will also cover Senate Resolution 562 filed by Senator Rafi Tulfo on the condition of the facilities of the National Center for Mental Health. May we now request the committee secretary to acknowledge the resource persons who are with us today, Mr. Comsec.
Good morning, Mr. Chair, and to the members of the committee. For this public inquiry and public hearing of the Committee on Health, we have the following resource persons. From the Department of Health, we have physically present are Dr. Gloria Balboa, Assistant Secretary for the Field Implementation Coordination Team. We have Assistant Secretary Leonita Gorgolon, who is also the Concurrent Director for the Health Facilities Enhancement Program. We have Dr. Racel Nika M. Howe, Director for Disease Prevention and Control Bureau. Ms. Annette B. Tan, Director 3, Health Facilities and Services Regulatory Bureau. Dr. Maria Teresa Vera, Director 4, Health Facility Development Bureau. ARIV Esther Pedido, from the Health Facilities Enhancement Program Management Office. Dr. John Aura Laurel Liabado, from the DPCB, Disease Prevention and Control Bureau. We also have Dr. Orlin Raymond Kilao from the FICT, Dr. Alexander de la Fendre from the Health Policy Development and Planning Bureau, Dr. Edgardo Tolentino, an adult psychiatrist specialized in addiction psychiatry. He is from the International Society of Addiction Medicine. We also have Dr. Carol Nara, Ms. Angelica Ginto, and Ms. Joyce Cordon, Ms. Wafa Bilao, and Ms. Alisa May Ardiente. From the National Center for Mental Health, we have Dr. Noel V. Reyes, the Medical Center Chief, together with Dr. Rico J. Caraos. From the Philippine Health Insurance Corporation, we have Dr. Albert Francis Ederlin Domingo, Director 3 for Health Finance Policy Sector, and Ms. Almira Sariba. From the Commission on Human Rights, we have virtually attending are Attorney Gemma Parohinog, Director 4, and Ms. Patricia Isabella A.C. From the Department of Justice, we have Attorney Christine Marie Veneracion Buencamino, Assistant State Prosecutor from the National Prosecution Service. And virtually attending is Attorney Bernadette C. Ongoko, Senior State Counsel. From the Department of the Interior and Local Government, we have Attorney Gino Lavarias, Attorney 3. From the Bureau of Jail Management and Penology, attending virtually is Mr. Voltaire Dulfo, psychologist. From the Department of Social Welfare and Development, attending virtually are Assistant Secretary Janet Armas for Standards and Capacity Building, Assistant Secretary Irene B. Dumlao for Legislative Affairs, Ms. Agnes Marcelia Lorenzana, and Ms. Cristina Marie Aguilar. From the Department of Labor and Employment, we have Ms. Jean Orsolino and Dr. Reynold Santa Ana Sr., Occupational Safety Officer. From the Department of Trade and Industry, we have Attorney Melquiades Marcos Valdez II, Officer in Charge of the DTI Consumer Policy and Advocacy Bureau, together with Mr. Russell A. Aragones, Senior Trade Industry Development Specialist, and Ms. Irene Porcadilla. From the Civil Service Commission, we have Attorney Crunimar Escudero III, Director 3. From the Department of Education, we have attending virtually is Ms. Jonna Kristen Valdez, Senior Education Program Specialist from the Bureau of Curriculum Development, Curriculum Standards. From the Technical Education and Skills Development Authority, we have attending virtually also is Mr. Noel J. Cuevas, Chief Technical Education Technical Education uh, Specialist, Mr. Noel J. Cuevas, and then we have Ms. Rosalie Esturco and Ms. Maria Teresa Angelica Balucas. From the Philippine Psychiatric Association, virtually attending is Dr. Robert D. Benaventura, the President. Together with attending physically is Dr. Joan May G. Perez Rifareal, Board Secretary. From the Psychological Association of the Philippines, we have Dr. Nino Jose Mateo, together with Ms. Joan Trina Moreno Javier, Board Member. From the Philippine Mental Health Association, attending virtually is Ms. Carolina Raico. From the Alliance of Filipino Families for Mental Health, attending virtually is Ms. Sally Domino Bongalonta, Vice President, together with Ms. Maria Celis Casas Gonzalez. And lastly, but not the least, Ms. Lucita S. Lasso, President of the World Association for Psychological Rehabilitation, also attending virtually. That would be all, Mr. Chair.
Salamat, Comsec. Let me acknowledge the physical presence of Senator Sherwin Gatchalian. Let me give my opening statement. Mental health is very important to address, just like any other health concern. It is an important part of our well-being. Sadly, mental health stigma continues to exist in our society, with many failing to recognize its signs and symptoms, especially among the youth. Palagi itong iniiwasan na pag-usapan dahil kadalasan nahihiya sila sa posibilidad na ma-discriminate sila ng tao. Umpisa pa lang ng pandemya, marami na pong naiulat na nakaka-experience ng depression dahil marami ang talagang naapektuhan. Nawalan ng kabuhayan o nawalan ng mahal sa buhay. The COVID-19 pandemic has also put the Filipino youth's mental health and well-being under immense strain. It was reported that according to the Department of Education, a total of 404 learners from public schools committed suicide in 2021 and 2,147 learners attempted suicide. Hanggang ngayon, maraming napapabalitaang nag-suicide o sumubok na mag-suicide sa mga paaralan. Nakakabahala po ito, lalo na sa mga kabataan na kung tutusin, napakarami na dapat na oportunidad sa buhay. Former President Rodrigo Duterte has earlier signed Republic Act 11036, or the Philippine Mental Health Act, which was sponsored and principally authored by our good colleague, Senator Risa Hontiveros in the 17th Congress. The law establishes a national mental health policy directed towards improving the health of the population. The said law also underscores the right of all Filipinos to mental health care. Specifically, it aims to provide mental health services at the barangay level and integrate mental health and wellness programs at the grassroots level so that interventions will be felt by the communities. It also seeks to improve mental health facilities and promote mental health education in schools and workplaces. It is, however, apparent that there are issues in the implementation of the remarkable law. I also want to particularly bring to our attention the observations of Senator Rafi Tulfo during his surprise ocular inspection at the National Center for Mental Health. Senator Tulfo reported the miserable conditions of some patients, with some being treated unjustly or even worse than animals. Ako rin po ilang beses na pong bumisita sa ilang mental health facilities noon at saksi po ako sa kawawang kalagayan ng mga pasyente doon. The state of the National Center for Mental Health is in need of utmost attention and improve to preserve the basic right of all Filipinos to health care. How can we decongest NCMH in order to improve its current slate? Where can we transfer recovered patients who have nowhere to go? Papansin ko po, pumunta ako ng Coron. May mga leprosy doon. Ayaw nang umuwi ng nakakalungkot po yung mga matatanda, yung iba 30 years, 50 years na po. Ayaw nang umuwi sa kanilang mga probinsya, sa kanilang pamilya. Maaring wala na po silang mauwian after 30 years. Ano bang pwede nating gawing intervention? Home for the aged, o saan ba natin dadalhin sila? Kawawa naman. Alam nyo, masarap mabuhay sa mundong ito. Isang beses lang tayong dadaan. Bigyan po natin sila ng halaga yung buhay nila na ma-enjoy naman nila after being committed po doon sa mga hospital facilities. Is the DSWD capable to accommodate them in halfway houses? What should be the proper referral system for patients with pending cases? Dahil nababalitaan ko marami pong may mga kaso, no, na nandoon sa mental health. Bakit sila nakukomit doon? Maring nagpabuang-buang sila. Ngayon, pwede na silang lumabas. Magaling na sila. So, ibalik na po doon sa kulungan para ma-decongest naman po itong mga mental health facilities natin. Anyway, sisingit ko lang po, di ba meron pong malasakit center doon sa mental health hospital para makatulong po sa mga pasyente, yung mga walang kakayahang magbayad, matulungan naman sila sa kanilang hospital billing. Ano pong dapat nating gawin dito? There are the issues and concerns that we aim to discuss and address in this hearing. Meanwhile, in the Senate, we have been doing what we can to support government programs for mental health. Mayroon pong 1.86 billion ang DOH for mental health medicines under the 2023 national budget. Mayroon din pong 12 million budget for mental health awareness and hotline. We have consistently advocated for increased funding for medical health programs. For example, in 2021, the DOH was granted an additional 384 million, 384 million for its mental health program, while in 2022, an additional 200 million was allocated for the same purpose. One of the key initiatives that we have pushed for in the 2023 budget is the improvement of benefit packages of the PhilHealth. The 2023 budget includes a special provision for the improvement of benefit packages of PhilHealth, including mental health packages. This provision is crucial given the sharp increase in mental health issues and the inaccessibility of mental health services. Marami talagang naapektuhan sa panahon ng pandemya. Talagang maraming na-depress at it causes mental health. Naapektuhan talaga yung ating mental health ng panahon ng pandemya. Yung iba nga nagpapakamatay. It is therefore my continuing call for stronger government interventions, particularly on the provision of psychosocial services. In this hearing, we will welcome the inputs of our colleagues, agencies, stakeholders, and experts on the updates of the implementation of the mental health law and the strategies we have to take to improve the mental health situation in our country. So, yun lang po. Patuloy tayo magdidinig. Anyway, nabanggit ko kanina yung sa Coron, yung Kulyon, Palawan po yung leprosy patient. Correction lang po, sa Kulyon, Palawan pala yun. Yun yung sinasabi kong napakarami pong mga pasyente na 30 years, 50 years na po, iba taga Mindanao, ayaw na pong umuwi sa Mindanao dahil wala na silang mauwian. Wala na yung pamilya nila o maaaring hindi na sila welcome dun sa pamilya nila. Yun po ang dapat nating i-address. Kasi sa tingin ko, ganun rin po ang problema ng ating mental hospital dito po sa Mandaluyong. Anyway, may I ask my fellow senators if they have any opening remarks? Senator Tulfo.
Thank you, Mr. Chair. First of all, I've been informed that Secretary Rosario Vergara cannot join us today because she has to attend a weekly cabinet meeting in Malacanang. And and I appreciate that for giving us notice as since yesterday. And Mr. Chair, nabanggit mo nga kanina, pumunta po ako sa National Center for Mental Health. This was a few weeks ago. And marami po ako napansin na mga pagkukulang, kapabayaan. At ako'y natutuwa dahil pinapunta ko po yung aking staff doon, isa sa mga staff ko, para tingnan kung naayos na nga ba yun, napag-usapan namin ni Dr. Noel Reyes. And fortunately, and I'm very happy to announce na nagawa ng paraan. O, di ba? O, natatawa si ma'am. Mamaya po ma'am, hindi kayo tatawa. Anyway, yung dating mabaho, naging mabango na. Yung dating marumi, naging malinis na. In short, salamat po, Dr. Reyes, at ginawa niyo po yung nararapat para sa kapakanan ng inyong mga pasyente. Okay. Now, Mr. Chair, National Center for Mental Health is not the mother of all irregularities, as some people think. However, I might say, it is the dinosaur of all corruption, because corruption inside NCMH has been happening for ages. And now, with the help of my colleagues, I'll make sure, right here, right now, we will make it extinct. Nakakalungkot isipin na yung mga pasyenteng pinagsisilbihan po ng NCMH people, especially mga matataas ang ranggo, they know na wala silang mga boses. And therefore, since wala silang boses at hindi sila makapagsumbong, they're being taken advantage of, being abused. Yung mga budget na para sa kanila, dapat mapunta for their food and well-being, na para mapaayos at mapagaling sila sa tamang panahon, hindi po nangyari sapagkat meron nga pong tinatawag na rampant corruption. Mamaya po, isa-isahin ko po itong mga korupsyon na nagaganap sa loob ng NCMH. Meron pong nangyayaring bantay sa lakay. Sa halip na bantayan ng kalusugan ng mga pasyente doon, sinasalakay yung budget na para sa kanila. And again, with the help of my colleagues, puputulan po natin ang sungay, pangil at buntot ang lahat ng mga taong sangkot sa katiwalian sa NCMH at ginagawang kawawa for a very long time ang mga pasyente doon. Trabaho lang, walang personalan. Now, Mr. Chair, I have a long list of mga katiwalian dito. Kulang po siguro ang isang araw kung isa-isahin ko to. But anyway, pipiliin ko lang po yung mga importante. And if you would allow me now to start, or would you rather have other people talk first, some of my colleagues? Kasi marami po akong katanungan at kailangan pong kasagutan dito. And I assure you, before the end of this hearing, may mga tatamaan, may masasaktan, at meron dapat masibak. Thank you, Mr. Chair.
Salamat, Senator Tulfo. Before po nun, ay pwedeng pakinggan muna natin ang presentation ng ating Department of Health tungkol dito sa updates po ng mental health, our topic for the day. Senator Sherwin, do you have any opening statement, sir?
Thank you, Mr. Chairman. Just a brief opening statement, Mr. Chair. The past few weeks, we've been conducting hearings on mental health for basic education. And we found out during the hearing that in just one school year, there were reported attempted suicides in our public schools. About 2,147 attempted suicides were reported in our public schools. And as you have mentioned earlier, Mr. Chairman, the actual suicides just on one school year alone, school year 2021-2022, is about 404 students who committed actual suicides. One life is too many, Mr. Chairman. That's why the Committee on Basic Education, which yours truly chair, um, conducted a hearing and will be close to sponsoring a bill that will go deeper into the mental health and wellness programs of our basic education institutions. And this hearing is timely because in the bill, in RA 11036, Section 23, it's mentioned there explicitly that the integration of mental health into the education system is mandatory as described in the law. But if you read the law very carefully, it gave you a broad framework on what to go into, but on the detail of what programs, who will implement the programs, what are the bottlenecks to implement the programs are missing. That's why the bill that will be sponsoring soon on the floor will be a complementary bill to this particular law so that we can fully implement and address the bottlenecks. Bottlenecks such as, for example, who will implement mental health and wellness programs in our school. We all know that we have 60,000 schools nationwide, but we only have 1,500 guidance counselors, registered guidance counselors in our country. So obviously, there's a massive shortage in terms of the personalities that will implement mental health programs in our schools. So those are the features that will be included in our proposed law. And I thank the chairman for conducting this oversight hearing. It's about time. No? Alam niyo ang mental health sa atin is not well understood by by our ordinary constituents. Kung may nararamdaman ho nila, ang normal solution is matulog, kumain. No? But it's actually deeper than that. And we have to admit that mental health is a severe condition in our country, not only for those who can afford medical treatments, but also for our constituents, less fortunate constituents who need government intervention in order to deliver assistance to them. So thank you, Mr. Chair, for conducting this oversight hearing.
Salamat, Senator Gatchalian. We shall first hear the presentation of the Department of Health. Please.
Apologies. So again, on behalf of the Department of Health, I'll be presenting the overview of our implementation of the Mental Health Pact in the Philippines. In 2018, the Mental Health Act included 6 main objectives, and this includes strengthening the leadership and governance for health, implementing a national mental health care system, ensuring the protection of rights and freedom of persons from psychiatric health needs, strengthening information, evidence, and research, integrating the mental health into basic health services, and promoting mental health in different institutions. With this, from 2018 to 2022, the Department of Health, with all of these different stakeholders, developed a framework for implementing these into a strategic plan of the 4 following pillars. The strategic plan aimed to ensure that mental health and well-being is valued, promoted, and protected. Conditions are identified, treated, and prevented, and persons affected by mental health conditions are able to exercise the full range of human rights. In the next slides, I will be going through some of our accomplishments based on the sections as indicated in the law. Chapter 2 and Chapter 3 talked about the rights of service users and other stakeholders and ensuring consent to treatment and safeguard. Following this, different governance frameworks and policies have been created from 2022 to 2023, indicating guidelines on how to go about these in different institutions. It includes in 2022 the guidelines on the ethical and responsible reporting and portrayal of suicide in media. In 2022, a guideline for informed consent support, decision making, advanced directives, and legal representation. And just recently, this 2023, the guidelines on the creation of mental health internal review boards and providing its rules of practice. With this, as specific milestones, the Department of Health has piloted the rollout of this with the World Health Organization. 62 personnel from the Commission on Human Rights, our regional offices, and service users organizations have been trained on the basic IRB training. There's also an pipeline of 51 additional high-level staff to be trained this year. And all of them have to complete the WHO Quality Rights e-training module prior to our basic IRB training. Similarly, we are also engaging with people with lived experience and also training them on how to better advocate for mental health and leadership within their organizations. Over 30 to 40 media practitioners have also been trained with the support of WHO to ensure responsible and ethical reporting and portrayal of suicide in media. For Chapter 4, Mental Health Services, the Department of Health has also spearheaded milestone policies to ensure access to basic mental health services, such as in 2021, the Medicine Access Program for Mental Health, 2022, the Resource Stratified Framework, which includes all of the different roles of each health facility within the healthcare provider network to ensure basic mental health services. Integrating all of these standards for guidelines for life stages in our Omnibus Health Guidelines in 2022, and also additional guidance on how to ensure implementation of this during COVID-19 in 2022. We've also created and piloted within local government units the implementation of community-based mental health framework and programs, which ensures that there's engagement of the community, building their capacity, strengthening family and support groups, empowering the service users, and ensuring continuity of care. Currently, our Health Facility and Service Regulation Bureau is also currently developing a licensing standards for mental health facilities in parallel with the upcoming PhilHealth benefit packages. Next slide. This next slide just summarizes also some of the milestones in relation to this. Currently, we have 362 access sites nationwide covering 27 priority mental health medicines with over 124,000 service users in 2022. The healthcare provider, the health facility stratified network has included 75 mental health facilities across the country, 23 of them to be specialty care centers, 52 as acute and custodial care facilities. We also currently maintain with NCMH the mental health hotline with over 53,000 cumulative calls from 2019 to 2022. And below are all of the trainings that have been conducted as mentioned earlier. Next slide. The Resource Stratified Framework for Mental Health Facilities outlines the types of services that should be available by level of care, and this also includes specific interventions of what can be managed at general care and what can be managed at specialty care. At the general care, delineating from province, district, municipality, and barangay health facilities include basic services in primary and intermediate, and our specialty care network to manage acute cases and advanced highly complex conditions and provision of specialized procedures. Next slide. The DOH with PhilHealth has also initiated development of benefit packages for mental health. The existing mental health benefit packages currently indicates a case rate for inpatient admission with a cumulative reimbursement of 35 million pesos to date. In the pipeline are benefit packages to be released for primary care, which will include primary care consultations, follow-up support, psychoeducation, and psychosocial support in mental health outpatient facilities, and an outpatient specialist package, which will include 12 consultations, diagnostics, psychoeducation, and psychosocial support with specialist centers, psychiatrists, neurologists, and psychologists. Next slide. On the Chapter 5 of the law for education, promotion of mental health in educational institutions and in the workplace, we have had a lot of progress with our co-national government agencies in implementing landmark policies for this. With DOLE, we had a joint order and the DOLE also released a department order creating mental health workplace policies in the private sector. CSC also adopted such for the public sector, and a joint administrative order with UH, DepEd, DSWD, CHR, TESDA, and DILG for healthy learning institutions. Mental health and substance abuse is also among the priority areas of our current health promotion framework strategy, and many multimedia campaigns have been initiated with DOH and in the stakeholders to promote the value of mental health. Specifically, as in the next slide, over 78,449 establishments based from the DOLE have adopted their own mental health policies in the private sector. 12,000 users are all currently using our Lusog Isip application, which includes self-paced management of mental health conditions. And we have a target 273 last mile schools in 9 province and citywide health systems for the Healthy Learning Institution portfolio. We're also rolling out through hospitals behavioral nudges for healthcare workers to implement mental health for our health workers. And this is the batch 4 currently of our rollout. 13 LGUs have also currently adopted the implementation of the peer support playbook for mental health. And we're already piloting the implementation in educational institutions for basic training for suicide prevention in schools with 42 teaching and non-teaching staff in the pilot pre-testing of this activity. Next slide. On Chapter 6 of Capacity Building, Research, and Development of the law, we are already regularly creating a national survey for mental health and well-being and developing the mental health protocols within school health systems. For surveillance, we have initially rolled out a surveillance for suicide attempt and self-harm in DOH hospitals, private hospitals, and local governments, and developing an ongoing information system to ensure the implementation and transition to a digital mechanism. For research and CPGs, the DOH is also currently in the pipeline creating CPGs for substance abuse and mental health literacy research. On Chapter 8, on the creation of the Philippine Council for Mental Health and the Mental Health Division, the Department of Health has chaired this interagency council meeting quarterly since 2021, and this has been the reason for many of the interagency policies and progress reported earlier in relation to the Mental Health Act. In terms of the mental health division in the DOH, all of them, the 8 plantilla positions are already filled. One has just recently sent in their resignation, but it's already also ongoing hiring. 3 additional job order personnel are supporting the division and 2 other plantilla staff from other offices. Next slide. In the next slide, I will just show briefly some of the future directions intended by the Philippine Council for Mental Health and the DOH in relation to our mental health programs. And this is really also our alignment with the global community to shift our services and address long-standing gaps and build preparedness. Moving forward, we aim to shift focus from specialized services and really integrating all of these into the general health and community settings, focusing on low-intensity interventions such as self-help, health promotion, and prevention, and integrating these services into primary care. And the next mental health strategic plan will be consistent with the DOH strategic thrusts of enabling people to be healthy, protecting from risk, caring for health and wellness, and strengthening health institutions and workforce, wherein this special focus will be given to the preventive side or the enabling people to be healthy side focusing on literacy, health-seeking behavior, and all of the supportive services that have to be available in communities, workplaces, in schools. The next strategic plan will also have stronger emphasis to address the social determinants for health and the vicious cycle between mental health and poverty and the lack of welfare safety nets and poor access to effective treatment, highlighting the need to address the social determinants of mental health. The institutionalization is a core strategy being pushed for in the global community right now. And this is something that we will adopt, but will be a technically and organizationally challenging process and will require transforming all of our mindsets involved in this to focus on responsible deinstitutionalization and humanizing mental health care, not just discharging people from institutions, but also ensuring we have the sufficient financial, structural, and strategic investments for community-based health services. This will also encompass redirecting some of our resources from the institutions towards the community to reduce admissions, scale up services, and increase our discharges. Lastly, the new administration's direction for illicit drugs facilitates the full implementation of the Mental Health Act of 2018. Per the discussions in the Dangerous Drug Board, which is the highest policy-making body for substance abuse, we will be focusing on prevention and rehabilitation, which is the public health approach to drug management. And with this, the mental health framework will be used as guide in the treatment of all substance users. The Department of Health has identified critical components in order to operationalize the public health approach to substance abuse and will really go through pursuing and sustaining the integration efforts of community-based mental health. As our last slide for the Department of Health, Mr. Chair, we will just like to share some of the directions that are going to be set in the 2024 to 2028 Mental Health Strategic Plan of the Philippine Council for Mental Health. It will include priorities on the institutionalization of mental health care with community-based mental health as one of the key strategies, mental health and substance abuse integration, monitoring and evaluation frameworks for mental health and substance abuse, ensuring the competency of all of the types of mental health professionals, workers, and service providers, and ensuring the access to social support services and addressing the social determinants of health. The strategic plan will again be co-developed with all of the members of the Philippine Council for Mental Health and other stakeholders. Thank you very much po.
Salamat sa DOH. May we now hear the presentation of NCMF and then NCMH at magtatanong po si Senator Tulfo afterwards.
Good morning, Mr. Chair. Good morning to the honorable senators, to the colleagues in the Department of Health. I'd like to present the instruction was to provide you with the updates on our compliance with the Mental Health Act and also if we are following our hospital development plan. So can I have the first slide? Just a briefer. Here are the contents of the presentation, a brief introduction, and then our compliance with the Mental Health Act, and also our implementation of the hospital development plan. Next slide, please. As a briefer, the NCMH is a level 3 classification as a specialty hospital. Its authorized bed capacity is around 4,200 with an implementing bed capacity of 3,500. Catchment population is national, of course. Our bed occupancy rate is at 71.67 if we're going to take a look at our authorized bed capacity. But if we're going to take into consideration our implementing bed capacity, our bed occupancy rate is at around 95.53. Our total admissions on a yearly basis is 5,352. Our average daily
inpatient is around 3,010. Average daily discharges at 14. The average length of stay is 290 days. Outpatient visits are around 75,000 per year. Our emergency room visits is around near 8,700 per year. For the performance scorecards, our hospital office performance and commitment review is around 4.86. Our iHome rating is 88%. Our green viability assessment rating is at 3 stars. And our PHU compliance rating, public health unit compliance rating is at around 100%. Next slide. The mandates of the facility is as follows. Next slide, please. All right. You can read that there are three major law that provides us with our mandate. The first one is in 1925. That's the Public Works Act. And then followed by the 2018 Mental Health Act and the Universal Healthcare Act. Okay. For our strategy directions and commitments, next slide, please. All right. I'll just state that for our strategy direction, the impact of the National Center for Mental targets, of course, better health outcomes, more responsive health systems, and more equitable healthcare financing. For our core processes, of course, it should include patient care, training, research linkages, and preventive, promotive, and public mental health aspect. Okay. Here are the service capabilities of the National Center for Mental Health. Next slide. As you can see, there's quite a few. Right. These service capabilities are categorized in psychiatry, allied health, training and research, mental health programs, and medical surgical aspect. Right. So next slide. For our compliance with the Mental Health Act can be categorized or summarized into three major aspects: research, training, and healthcare. For research, we have coordinated with stakeholders in the formulation of a research agenda. We have collaborated with government agencies as well as local and international academic institutions and other organizations to undertake and publish research on mental and neurological health. And NCMH is acting as a repository of research pertaining to mental health governed by the guidelines approved by the Department of Health. As for training, the NCMH has proceed with the reorientation of its present program as an institution, providing predominantly clinical service to a facility primarily designed to serve the needs for training, education, and research. The design appropriate for relevant capacity building programs for various mental health providers. And for healthcare, develop research-based local models of care to affect the best health outcomes, and develop a program that provides a balanced and hospital-based care and strengthen community-based mental health care. Next slide, please. For again, in compliance with the Mental Health Act, we have in research, we have facilitated the National Mental Health Research Forum together with the Philippine Council for Mental Health to come up with a list of priority mental health related researches. And of course, the development and publication of research papers. We have partnered with the UP Philippine Genome Center, the University of San Agustin, University of Asia and Pacific, the Society for Pinoy Neuroscience Enthusiasts on various research initiatives. As a research repository, it establishes NCMH as an institutional research repository through a memorandum of understanding with DOST, Health Research and Development Information Network, or HERDIN. And we have trained some personnel about HERDIN database and on uploading the research into database. As for our compliance in terms of training and capacity building, we have formulated a strategic plan and roadmaps for the transition of the National Center for Mental Health as a research and training institution has been completed and approved already. Also, the NCMH organizational restructuring plan. We have collaborated with other Department of Health hospitals in setting up of mental health services as advanced or basic comprehensive centers for mental health, acute psychiatric units, and mental health crisis hotline management. So with our capacity building programs for various mental health providers, we have conducted capacity building and training activities to various stakeholders in school, workplace, and community, and provided technical assistance to primary healthcare centers through the MHGAP. For the healthcare information, next slide, please. Healthcare information, the NCMH has participated in pilot testing of the implementation of informed consent, for mental health and advanced directives, as well as suicide registry. We have developed local version of hospital-based electronic medical records, primarily designed for the mental health information system. And to balance the hospital and community-based mental health care, we have established and upgraded patient care services, neurophysiology, transcranial magnetic stimulation, psychological clinics, and that is required as an APEX or referral facility. We have expanded the NCMH crisis hotline from Luzon-wide to nationwide coverage and provided the telemental health services. We have converted the Camarin branch as model for the Daloy ng Pag-asa Recovery Program and established community-based mental health programs. The implementation of the hospital development, the goals and objectives are as follows: improve access to mental health services, a patient-centered and rights-based healthcare delivery, a competent and high-performing workforce for mental health, improve capacities for training, research, and information system, and as an observatory and reference center for mental health, NCMH should expand its delivery of health services at appropriate levels of care, strengthen its leadership and management capabilities, as well as its coordinating mechanism to ensure high-quality, patient-centered programs, services, and facilities. Can we now go to the next slide? Next two slides. I guess it's late. I'll just state our financial resources. Next. Next slide, please. Next. Yeah. All right. Here you can see from 2018 up to the present, our GAA, in terms of our MOE and our utilization. For the GAA 2023, we are on target as our first quarter utilization is at around 26.74%. Okay. In terms of what Mr. Chairman has pointed out about the malasakit funding, NCMH has received around 133,345,000 in terms of malasakit funding. And as you can see, what we have obligated is around 61% and what we have disbursed is around 98%. Truly po na nakakatulong po ang malasakit sa mga pasyente. No? Right? Next slide, please. Here you can see our human resource. As in any other tertiary hospital, we have fast turnaround on our nurses and in our doctors. And we still have to fill this up, our vacancy. However, it is worthwhile to note that we have already submitted our manpower complement for a 3,500 bed capacity to the Department of Health. And at present, we are processing the additional requirements for its endorsement to DBM. Our nurses totaling in the plantilla should be 1,473, and we are at 1,330. Unfilled position for nurses is around 143. That's it. For our implementation of the hospital development plan, next slide, please. I'll just browse on this. No? As you can see, the timetable for our targets 2022 to 2020 up to 2028, and it is there in terms of our healthcare services: outpatient, emergency response, crisis intervention, short-term acute inpatient, long-term chronic inpatient, custodial care, the crisis hotline, the Daloy ng Pag-asa, and the community-based program. Next slide. As for our specialized psychiatric programs, the forensic psychiatric care, the child and adolescent psychiatric care, the psychogeriatric care, the neuropsychiatric care, the neurophysiology, featuring our EEG, EMG, our transcranial magnetic stimulation clinic, our magnetic resonance imaging, and our sleep laboratory is in the works already by 2023, and with the full implementation of some of these programs by 2024. Next slide. As for the training, research, and program development, our specialty training in psychiatry, as you can see, by 2024, we are expecting a neurology consortium. And for this year, in terms of our subspecialty fellowship training, we're about to go with the geriatric, forensic, and consortia with the CAP and CLP. Certification courses we have in crisis hotline and plus our psychiatric nurses. For linkages and expertise in technical assistance, we are providers of the mental health profiles of mental health facilities. Research generation and repository, mental health data and information hub. Next slide, please. Here you can see the physical health and general hospital services of the National Center for Mental Health. We have internal medicine, surgery and trauma, physical medicine and rehabilitation care, pathology and diagnostics, and the blood bank. The next slide. Here are the infrastructure and facilities. You will see that the expansion of patient areas will be up to 2026, as well as the new construction for other areas. The repair and retrofitting upgrading, NCMH was established in 1925, and as you can imagine that some of the buildings are very old, and that the maintaining of this building should be year round. And this we ask for the help of course, DPWH in providing us with technical assistance in terms of retrofitting these facilities. But some of these facilities are beyond repair, and that is the reason why they are now considered in the timeline for new construction and expansion of this building. I think that is the last slide in terms of our compliance and implementation of the hospital development plan. Thank you, Senators. Thank you, Your Honors.
Salamat. Before sa mga tanong ni Senator Tulfo, no? Meron po akong tanong, itong mga outpatient services and medications, ano bang pwedeng i-avail nila? Sabi mo kanina, about 70% po yung mga admitted, no? Yung mga inpatients, 90% yung occupancy nung sa inyong allowable. Ngayon, itong mga outpatient services and medications, anong cases po ito? Interesado lang po akong malaman to what extent yung kanilang nararamdaman para aware po yung publiko na magpagamot sila at wag silang matakot magpagamot. Baka yung iba ayaw pumunta ng mental health hospital dahil baka sabihin ma-discriminate sila, bakit ka pumasok diyan sa loob ng mental health hospital. So pwede mo bang ma-explain sa publiko kung mga minor cases nade-depress, ano ba yung medication na gagawin nyo? Marami pong interesado. I'm sure sa panahon ng pandemya, napakaraming gusto magpa-check up, mag-avail ng gamot. Sabi mo nga, malaking tulong po yung mga malasakit center diyan sa mga pasyente. They can avail of it para naman po yan sa mga poor and indigent patients.
Thank you, Mr. Chair. Yes, sir. The outpatient section of the National Center for Mental Health, as the data has been presented to you, addresses those patients suffering from mental health issues that have not fulfilled the criteria for admission, or these outpatient patients have been discharged and now on a regular follow-up with the facility. Also, first-time consultations also, we address those who are being referred by different agencies, schools, workplace, for certification, or sometimes for fit to work, resumption of work, and other requirements. No. Sa tanong niyo po, Mr. Chair, truly po that stigma plays a big role in terms of the people accepting that they have certain mental health issues. The outpatient section po has bukod po sa face-to-face consultation ay meron ding telepsychiatry at meron din pong online consultation. So they need not go to the NCMH, no, physically, but they can call all these calls, no. Tama po that some of them have when they go to the hospital, the consultation fee is free. The medication they can get through malasakit, which is free also, and as long as they comply with the scheduled visits, they will be seen in the outpatient section. Po.
Maganda rin po yung idea na about the telecon
Apo.
para hindi na sila kailangan pumunta doon sa ospital, hindi sila mahiya, at hindi sila ma-discriminate. Marami pong ganon. Marami akong narinig na nahiya lang silang pumunta ng ospital. Ayaw magpa-check up dahil sa nararamdaman nilang depression sa panahon ng pandemya. Another, no, itong nakita ko yung bakante ng nurses, 107 unfilled nurse position. Yung nasa gobyerno, maganda naman po yung sweldo. Unlike sa private na napakababa, isa po yan sa aking gustong tingnan, no? Yung napakababang sweldo ng nurses sa mga private hospitals. Though binabalanse naman natin dahil dyan sila kumukuha ng to sustain the hospital, yung kita nila. But nababalitaan ko mababa talaga yung sweldo ng nurses at underpaid sila sa private. Tayo, yung mga na-admit naman sa mga private hospitals, yung mga mayayaman, di na nagche-check yan ng babayaran. Bayad na lang yan sila diretso. Hindi humihingi ng discount yan. So, sana na may mapataas naman yung sweldo ng mga nurses na nagtatrabaho sa mga private hospitals para wag na silang mangibang bansa. Yun ang reason na nagkakaroon tayo ng shortage dito sa ating bansa dahil napakababa talaga ng sweldo ng nurses, lalong-lalo na po sa mga private hospitals. Daw sabi ko nga, binabalanse siguro nila. Ngayon, tinitingnan ko po yung 107 unfilled nurse positions ninyo. Bakit hindi po encourage yung mga nurses? Malaking sweldo na sa gobyerno sa mga nurses natin. Baka pwede ibigay sa mga gustong magtrabaho dyan sa mental health hospitals. Mahirap ba yung requirements niyo sa nurses?
Actually po yung Mr. Chair, the vacancy is because of the fast turnover of the nurses. after being employed at the National Center for Mental Health, dagdag na po yan sa kanilang CV that they can apply experience that they can apply abroad, which psychiatric nurses are very in
Yes.
demand abroad po.
Baka
And-
pwedeng matulungan nyo na lang, ma-fill up kagad,
Ayun po. Sa ngayon po, efforts are being done really po to fill up the vacancies.
sayang, dami nating nurses na walang trabaho para hindi na lang sila mga ibang bansa, dito na lang sila. Anyway, Senator Tulfo, you may proceed with your question.
Thank you, Mr. Chair. I would like to direct my questioning to Dr. Noel Reyes. Dr. Reyes, si Dr. Beverly Azucena, isa po sa mga nasampahan ng kaso sa ombudsman. And Dr. Alden Cuyos, siya po at that time nung magsampahan ng kaso, and nagsampa ng kaso noon ay si Roland Cortez. And who is Roland Cortez? Siya po yung may posisyon ninyo ngayon. Kaya po siyang in-expose niya dahil gusto niyang linisin siya ng 3 pwesto. And before you answer that question, did you know na itong si Dr. Beverly Azucena at Dr. Alden Cuyos ay magkasintahan? Wala akong problema kung sila po'y magkasintahan. Ito po'y, ano po to alam po to na marami sa NCMH. Wala tayong pakialam kung sila po'y magkasintahan. Ang pakialam po natin, sila po ay parehong merong sensitive position at pwede nila magamit yung kanilang position bilang tag team para ma-facilitate ang mga gusto nilang mangyaring kalokohan. Now, answer please my first question. Bakit niyo po binigyan ng sensitive position si Dr. Azucena the fact na siya po ay kinasuhan sa ombudsman at siya po ay na-promote po niyo. Promote niyo pa po. Dr. Reyes.
Thank you, Honorable Chair. Honorable Senator. To answer that po, the position of Dr. Beverly Azucena is not for me to give.
And who gave the position, sir?
The item po of the Chief Medical Professional Staff, ang nag-a-appoint po niyan is the Department of Health, not the Medical Center Chief.
So you're saying na ang Department of Health ang nag-appoint sa kanya?
Yes po, and
At pero pwede niyo po siyang harangin bilang po Medical Center Chief. Pwede ho kayo magrekomenda. Am I right or am I right?
the appointment po, Senator, happened before I was in the National Center for Mental Health. I came at 2018. She was already a chief of clinics by so much earlier than that.
Still, para naman po i-honor nyo yung memory po
Na,
ng inyong pinalitan na si Dr. Roland Cortez na napakatino na opisyal na pinatay, minurder, inassassinate dahil sa kanyang expose ng mga kalokohan dyan sa MCMH. At isa sa mga kinasuhan niya ay si Dr. Azucena and now siya po ay na-promote.
wala pong
And on top of this, si Dr. Cuyos po na head ng Bids and Awards Committee at that time, siya po ay na-promote at nabigyan pa 3 pwesto. At alam po ninyong lahat, at alam po dito sa NCMH, again, allegedly, sabi nila doon, ito po yung dalawa is in a relationship. Now, i-deny mo to, may mga question ako. Are you denying it or not? And my question to you now directly, friendship po itong dalawa, yes or no? If you said no, then meron ako ibabato sa iyo na katanungan.
they are co-workers and therefore they are friends, of course.
They're
po.
friends. And you're friends with these two, and you go a long way, right?
So with other doctors in the-
Exactly. Correct. Now, bakit po hindi nyo nirekomenda na bigyan na lang ng ibang posisyon itong si Dr. Beverly Azucena at itong si Dr. Cuyos?
Uh,
Now, go ahead.
to answer po, Dr. Cuyos neither received any promotion.
No?
No promotion po. It's a designation.
He's
Being the chairman of the Bids and Awards is not a promotion, sir. It's a designation. It's an added duty.
yes, he is the head of the community. As such, siya po ang nagde-decide kung sino po ang mabibigyan ng kontrata.
No po. NCMH is very unique at having 2 chief of clinics, one for hospital
I
and
know.
one for community service.
Correct.
Dr. Cuyos is an OIC, meaning hindi pa po siya na-appoint ng Department of Health as a chief of
Hindi pa
PH.
siya na-appoint pero nagagawa na niya, nagagampanan na niya yung mga tungkulin bilang chief, although he's just an OIC, right?
OIC po.
Okay,
Oo.
pinaikot niyo lang po
Hindi,
yung aking katanungan.
kasi
But
po,
still, even if he's
Apo.
only an OIC, nagagawa niya po yung ginagawa ng isang tao na designated na talaga bilang chief,
Opo.
right?
Yes, sir.
Okay. Bakit ko po naitanong ito? Let's start with the food. Dati po, yung mga pagkain, yung raw food products, tama? Binibid niyo po yan,
Mhm.
it's under goods. And after yung manalo sa bidding, dinadala po yung raw food products, meat, poultry, vegetables, fish, etc. At doon po niluluto ng dietitian ninyo sa NCMH. 80 million po ang worth noon at that time. Now, ano pong ginawa nitong si Azucena at si Cuyos? Alam niyo po ito. But anyway, sasabihin ko rin sa inyo. Ang ginawa po nila, in-outsource po yung bidding para sa food. One. Number two, nung in-outsource po nila ang bidding for the food, biniyak-biyak po nila yung kontrata na dapat isang kontrata yon. One contract for food, biniyak nila sa breakfast, lunch, and dinner under one contract, which is wrong. Number two, matapos nila ma-outsource yung sa food, 3 years contract. Biniding po yung first year. Succeeding year, second year, third year, wala na pong bidding. Kasi nga po, nilagay nila sa services. They go around with it, the system. Sa second year, renewal na lamang, Mr. Chair. Third year, renewal na lamang. At pwedeng pataasan na ng presyo dahil nga hindi na bidding, renewal na lamang. From 80 million, now it goes up to 250 million. At yan po dahil sa pakikipagsabuatan di umano ni Dr. Azucena at Dr. Cuyos. Now, I may add, i-deny mo na wala silang relasyon. Yung cottage po na tinutuloyan ngayon ni Dr. Cuyos, right? Inside NCMH. Under sa name po ni Dr. Azucena. And meron po mga records. If you will deny this, then I will show you some records later on na itong dalawa, minsan kasama ka pa, nag-abroad kayo. Yes, you may say no. But later on, documents will be produced. Now these two, they go out of the country several times magkasama. And there was one instance or probably a couple of instances na kasama ka rin. And you will deny this, of course. Karapatan mo mag-deny. But records will show later on. Now, bakit po ganon? Alam naman po natin na napakahalaga yung pagkain para sa mga pasyente. Kailangan po yan para sa kanilang kalusugan, para sila po'y mapagaling. Ang nangyari, binabalasubas po ang mga pagkain nila. Kulang-kulang, bitin. In fact, if you remember, Mr. Chair, nung pumunta ako doon, isa sa mga pasyenteng nakausap ko, sabi, bitin po sir ang pagkain namin dito. Ibig sabihin, God damn, pati sa pagkain, wala nang awa, dudugasan niyo pa yung mga kawawang pobreng pasyente ng NCMH. Another conflict of interest. Sunshine recovery. You know what is sunshine recovery? Alam niyo kung sino may-ari ito?
It's a group of doctors.
Exactly. And you know that that's conflict of interest. And why do you allow it? And why did you allow it? It's conflict of interest sapagkat this is a psychiatric facility owned by Reyes, Cuyos, and Avila.
I'm
Did
sorry.
deny mo? I'll produce a record
Yes,
later
sir.
on.
Kindly, sir.
Yes.
Ah.
So, bakit po ina-allow ito na mangyari itong conflict of interest? Why did you allow it?
Sir, just to answer your allegation, sir, uh, the outsource of food was not due to Dr. Cuyos and Dr. Azucena. The outsourcing of food was decided upon by Dr. Cortez, our former director, because he observed that when we purchase raw food, pilferage was rampant. Now, so he outsourced it. It was during the time of Dr. Cortez that the outsourcing of the food happened. Right? So,
Excuse me, sir. Produce a record showing
Yes,
that it
sir.
was Dr. Cortez's time na ito po ay nag-outsource na kung saan from 80 million ay naging 250 million. And let me remind you, sir, are they under oath, Mr. Chair?
yes. Ay, hindi pa.
Pwede ba paki-under oath ito, Comsec? Please put this gentleman under oath.
Dr. Reyes, may I ask you to stand, sir, and raise your right hand? Do you swear to tell the truth, the whole truth, and nothing but the truth in this investigation, in this inquiry of the Committee on Health and Demography?
Yes, sir.
You can sit, sir.
Si Dr. Cortez po ay isang matinong tao. Kaya nga po, in-expose niya po yung katiwalian na ginagawa ng kanyang mga kasamahan at dahil po dyan, nabuwis po yung kanyang buhay. Siya po'y minarder, inassassinate, pinatay. At yung pong sangkot sa pagpatay sa kanya ay si Avila. Kailan niyo po yon? At yung pong gunman, confessed gunman, itinuro si Avila na kanilang mastermind. At kasama po sa mga kinasuhan dito, isa na ay itong si Dr. Beverly Azucena. Now, you're telling me itong questionable na pag-outsource ng pagkain ay kagagawan ni Dr. Cortez na kung saan from 80 million lumundag sa 250 million, going up to 300 million pa siguro. Kagagawan ni Dr. Cortez? Now, nakakalungkot po, nagagamitin mo po yung pangalan ni Dr. Cortez, patay na po siya at wala na ho siyang kakayahan na idepensa pa sinungalingan yung anuman allegations meron kayo against him now. And I know na kaya niyo pong manipulahin nila, not you. But there are certain people there na kaya manipulahin yung mga dokumentong palabasin na si Dr. Cortez ang may kagawaan kahit na hindi siya. And wala na po siyang kakayahan magdepensa para i-deny because he's dead. Because he was murdered, because he was killed, because he exposed all this katiwalian na involved po ng ilan sa inyo dyan sa NCMH. I'm not saying exactly nakasama ka doon. But I'm saying is there are some people, unfortunately, these people are your henchmen or alipores mo.
Actually po, I'm stating the opposite. It was Dr. Cortez who observed that the patient is not been receiving adequate nutrition. And that is the reason why he outsourced it. Because during the time po na in-outsource niya, nawala po yung pilferage ng mga raw food materials. Pangalawa po,
Okay, if your problem is pilferage, how much is that pilferage of food cost? 80 million compares sa in-outsource nyo to 250 million. Does it make sense? Does it connect? No.
actually po,
Kung pilferage po ang pinag-usapan nyo, 80 million, okay? 80 million. Pinipilfer tong 80 million. Sabihin natin, for the sake of argument, pinilfer po yung kalahati ng 80 million. 40 million pala dyan na pupunta sa pilferage. My God. Versus, nung in-outsource, umabot sa 250 million ang halaga. Does it make sense? You don't have to be a rocket scientist to figure it out.
I agree, Senator. But during that time, no, the caloric requirement for a patient was stated at 1,800 kilocalories. No? Kaya po yung cost ng outsource, dun po nakakompute. And during that time po, since it's outsourced, of course, it is going to be bidded out. At marami naman pong sumali sa bidding
Yes,
process.
but the bidding is only done the first year. Second year, wala na pong bidding. Ang nangyayari po, renewal na lang. And third year, renewal na lang. which is bawal. Pero alam niyo pong ginawa niyo? Kasi kapag sa goods yan, kailangan po bidding yan yearly. So, nakakita po kayo ng butas, umikot kayo, pinasa niyo po sa services. Dahil pag sa services, hindi na nga po yan i-renew na lang.
Actually po, the outsource contract awarded to the winning bidder was signed by Dr. Cortez, and it stated that in the terms of reference that the contract is 3 years, renewable every year.
Question muna, Dr. Reyes. Yung sinabi kanina about the designation of the BAC chairman. Ang question ko po is, sino po ang nag-designate ng BAC chairman? Sino po ang nag-designate ng BAC chairman po?
Usually po, it's the medical center chief.
So kayo po ang nag-designate ng
But
BAC?
during the designation of Dr. Kasi doon na po siya dati galing eh. And during my time, during Dr. Cortez time, I was the chairman of the BAC. And
Itong current BAC chairman, sino po ang nag-designate sa
sa
kanya?
ngayon po, it is chaired by Dr. Vic Pontabella and Dr. Alden Cuyos. Dalawa po. Hinati na po namin
So,
yung...
kayo po ang nag-designate sa kanila? Okay. Second question. Itong mga pasyente na sinasabi niyong binibigyan niya ng mga pagkain, no? Since meron silang mental health problem, meron bang nakakareklamo ba sila?
Yes, sir. Yes, Mr. Chair.
I don't think so.
Yes po.
I beg to disagree.
There
No,
are-
sorry, Mr. Chair.
Mm.
No, you know better.
Po.
Ang mga mental health patients, they're considered as forgotten, even by their families, except doon po sa mga nasa pay ward. Mr. Chair, they know that. Now, these people are voiceless. Wala silang boses. Hindi sila makapagreklamo. And as such, they're being abused. But now, I'm telling you, Mr. Reyes, meron silang boses at yung boses nila nakabibingi. At ang boses nila ay Senado. I'll make sure of that.
And that's the reason why po we are eradicating that. We are putting voices in these patients po. They are stating their condition to the nurses. Gutom pa ako. So the nurses will take effort now to have a second serving.
Sa klase ng pagkain, nakakareklamo ba sila?
Opo.
Ano
Sasabihin
nabibigay?
nila, walang lasa, o sasabihin nila. So we try to improve on it, sir.
No, sir. Mr. Chair, like I said, when I went there, one patient came to me at bumulong, "Sir, bitin po yung pagkain namin dito." At least kasi from the outsider ako, at kilala ako nung pasyente. Kilala niya ako. Sabi niya, "Sir Rafi, bitin po yung pagkain namin dito."
Na-address niyo itong mga reklamo?
Yes, Senator.
Now, kung
Marami
sinasabi
pong-
niyo po sila po ay nakapagreklamo at pinagbibigyan yung reklamo nila, bakit po nagreklamo sa akin nung
Talaga
pumunta po
pong-
ako doon?
Talaga po maraming magrereklamo, but if we are as a fulfilling the requirement of their caloric requirement per day, then that is our task po talaga to provide nutrition. Maaring subjectively gutom pa sila, but we have already provided the required caloric requirement for them.
Napaka-importante po nito, Dr. Reyes, para gumaling yung
Ay-
pasyente, dapat
I agree po.
makomply niyo yung requirements talaga nila.
Right now po, the Department of Health has come up with the standards for the caloric requirement per age group po. And we're following that up religiously po.
Okay, Mr. Chair, siguro ang gagawin ko next time, magpapadala ako ng tao doon at titingnan ko po habang sineserve po yung mga pagkain because the last time I was there, nakita ko lang po yung mga kawali, nilalagyan ng mga pagkain, pero hindi ko po nakita kung gaano karami yung pagsaserve ng food.
Senator Tulfo. Sir, andyan si Beverly. Okay lang bang tawag? Nasa online po si
Maganda muna, Mr.
Beverly
Chair,
Azucena.
si Mr.
Sige, go ahead.
Kasi
Nakita
kayo
ko lang po
pinaka-
si
Opo.
Beverly Azucena.
I'll
Later
talk to
po.
Beverly later.
Opo.
Okay. Bakit nakakalusot sa renewal ang head ng dietary section ay isang malapit na medical center chief ng NCMH? Anyway, alam ko na ito. Dr. Reyes, pabalikan natin yung food. Alam niyo po siguro ito na marami sa mga spaces, lupa diyan sa loob ng NCMH, ay pinamimigay bilang proyekto ng mga government officials. And you know that. Eskwelahan, multipurpose building, left and right ang construction. Project po ng mga government officials. Pinapayagan. In exchange, listen to this, in exchange for contract sa infra, ibibigay sa isang kasama nyo dyan. Did you know that? Yes or no?
No, sir.
Then you should resign. Sino po si Planning and Development Chief Engineer Evelyn Purino?
That's our planning and development. Yeah.
Oh, there you go. Sabi mo no. Pinamimigay po ang mga spaces doon sa NCMH, construction po left and right ng mga material ng mga buildings tulad ng eskwelahan at, like I said, multipurpose building. Wait a minute. With the condition na yung kontrata sa infra, bahala na si Chief Engineer Evelyn Purino. At si Evelyn Purino ay merong anak sa DPWH na si Engineer John Paulo Telmo Purino na siya po ang umaayos sa program. Alam ko, tapos ikaw hindi mo alam.
Talaga po kasi she's not authorized to give away lots because that lot is for the Department of Health to give away.
Exactly. Kaya nga, dapat you should have known that. Bakit ako nalaman ko, outsider ako?
Wala po talaga akong knowledge na she can give,
Well, you
give
should-
it away.
She did. Well, it's being given away. Katulad ng eskwelahan. I was there and I saw the school.
It is not for her to give away, sir.
Well,
She's not authorized.
if she's not authorized, then bakit mo pinayagan?
That school po was established around 2017. Wala pa po ako sa National
Okay.
Center for Mental
Now,
Health.
wala ka pa. Pero how about itong mga tinatawag na multipurpose building? There are some constructions going on.
Yes, sir. There's one multipurpose building that was established during the time of Dr. Cortez.
Okay,
Mga-
palagi mo sinasabi Dr. Cortez.
Yes, sir.
Unfortunately, si Dr. Cortez ay pinatay na. Wala na po siyang kakayahan na idepensa ang sarili kasi baon na siya 6 feet below the ground.
Yes, sir.
Ang hirap po kasi sa inyo, Dr. Reyes, panay ang tulak mo kay Dr. Cortez na patay na yung tao at saka, come on, Dr. Reyes, matinong tao si Dr. Cortez. Kaya nga po siya nag-expose
Ay po.
kasi gusto niya po malinis yung kalokohan dyan sa loob ng NCMH. And because of that, siya po ay pinatay. Now, you keep saying every time na meron akong sinasabing katulian, binabalik mo kay Dr. Cortez, puro Cortez ka ng Cortez. Come on.
Because these are his innovations po. Ito po yung improvements na ginawa niya sa NCMH. Not the other way around.
Now,
I'm
okay,
stating
sige,
that-
granting innovation niya. Ngayon, granting, for the sake of argument, sige, sasakyan kita. Then, pagpasok mo, nakita mo na may mali, bakit hindi mo kinorek? And may kakayahan ka because ikaw ng boss ngayon.
These are, as I've stated, Senator, these are innovations and improvements. How can I correct it?
No, you can correct it because you can call the shots because you're the boss now. Granting na talagang si Dr. Cortez may kagagawan. Okay, meron siguro mali doon sa tingin mo. Sabi mo sana, okay, guys, baguhin natin to kasi baluktot to, mali si Dr. Cortez.
Wala po nga
Okay.
ako sinasabi. These are
Yung
his-
innovation na sinasabi niya, hindi
Improvement.
tumutugma sa tinatawag na good governance. Okay? You can use those lines.
Pero
You
wala-
can tell your Alipores na hindi po tumutugma to sa good governance ito mga innovation na inilatag ni Dr. Cortez. So therefore, baguhin natin, guys. But you didn't do.
Because these are innovations nga po and improvement. How can I change something that is good?
Good?
Kaya nga po
From
sina-
80 million, sabi mo pilferage? Okay, kung merong pilferage na nangyari, then you should have corrected. Well, sabi mo naman, Dr. Reyes. But listen again. Do the math. 80 million pesos at nagkaroon po ng pilferage doon sa 80 million, pero ang kapalit naman doon, dahil lamang sa pilferage doon sa 80 million, sabihin na natin lahat na yung pinilfer, 80 million. Okay? Para mas mapadali, parang balik tayo sa elementary. Pareho tayo mahina siguro sa math. Ngayon, ang pinalit, 250 million.
Yes, sir. Because the quality of the
No.
food improved, sir. Because it's an outsource. There's a new
And
terms of
bakit yung
reference.
biniyak yung kontrata? One contract, and then in that one contract, biniyak yung pa another subcontract, breakfast, lunch, and dinner.
Again, sir, that happened during
Oh,
220.
test ka na naman.
No, sir. That happened during the time of when I was the chair of the BAC, when I was doing the
Okay.
bidding. All right, sir.
Now,
I was instructed, sir.
but now you are the boss, meron kang authority na baguhin yan.
Sir, bago na talaga.
Hindi, baguhin mo yung contract, sir. Because the contract Hindi po tama.
Yeah.
The 80 million, may balik niyo po doon sa 80 million.
Wala
Ngayon kung sinasabi mo, dietary, then let's call the experts. Sa susunod na hearing, patawag tayo ng mga experts. Magpapadala ako ng mga tao para mag-observe doon. Magpapadala ako ng mga dietitian. As simple as that. Para observe, tingnan natin kung talagang tumutugma ba doon sa 80 million versus 250 million. In fact, 300 million na raw ata, paakyat pa yung maging price niyan.
the
Come on, to meet the dietary requirements of the patients,
Yes, sir.
gagastos ka ng 200 million more? Come on, ano tingin mo sa mga pasyente dyan? Ang tatakaw?
for 3,000 patients, sir, inpatients.
Eh, bakit nagkasya ang 80 million? No.
We were the ones cooking it and
Then bakit mo hindi balik ulit sa you guys will be cooking it? And mind you, let me add, itong outsource na kinuha ninyo para mag-provide ng mga pagkain, okay? Ang ginagamit nilang LPG po na NCMH.
Hindi po. Before, that was our LPG. But the subsequent ordering of this LPG, sila na po ang gumagastos nito.
Pero ginagamit yung tangke ng LPG nung the start, right?
At the start po.
Okay.
Kaya po, my explanation is, yung sinasabi niyo po na separate, it was during the decision po na,
Si Cortez na naman.
hindi po, natignan natin kung magaling itong outsource. Breakfast lang ang i-outsource natin. After which po, okay, you can now bid for lunch and dinner. Kaya po nagkahiwalay yun.
No, you should not do that. Bawal po yun.
I did not do it, sir.
Technical malversation po yun.
I
I've
did not-
consulted my lawyers.
I did not do it, sir.
Cortez did it. Exactly.
That
Patay na
was
kasi si Cortez eh.
No.
Pinatay eh. Minarder eh dahil sa kanyang pag-expose ng
But
katiwalian.
that was an improvement, sir. Because it's the first time.
No, it's not an improvement. An improvement para mas maraming pera maibulsa. Improvement sa pangungurakot. Kasi maliit lang ng kurakot sa 80 million versus sa 250 to 300 million, malaking perang may kukurakot. So there's a big improvement as far as corruption is concerned.
But these are really, sir, transparent, no? We can provide you with some of the data.
Yes, that's why I'm saying,
Yes, sir.
sa next hearing, Mr. Chair, mag-invite tayo ng mga dietary experts.
Yes, sir.
Mag-invite tayo ng mga tao na involved sa kontrata ng pag-provide ng pagkain and then magpapadala po ako ng mga tao para mag-observe. Titingnan po natin kung tumutugma yung 300 million na kontrata at bibiyak-biyakin ng 3 beses para mabigyan ng maayos na pagkain ng mga pasyente. And again, my lawyer said na that was technical malversation. Again, you will say, si Dr. Cortez. Now, you're the boss. Kung talagang totoo si Dr. Cortez, for the sake of argument, sabihin natin siya nga talaga, may he rest in peace. Do something. Kung alam mong mali, maluktot,
Yes, sir.
injurious sa gobyerno, then do something. Stop it.
And that's the reason why, sir, in the recent bidding of the outsourced food, isa na lang po talaga ang kontrata.
And therefore,
for 1 year.
ibalik niyo po ulit sa loob. Yung raw food materials ang ibid nyo and then ang magluluto yung mga dietitian nyo. Kasi ang sabi mo, problema lang is pilferage. Kung yun ang problema lang pilferage, ayusin nyo.
And the quality of food. And that's our plan, sir.
Quality of food, then nasa inyo na yan pagbibidding. Kayo na bahala maghanap ng magaling na magpa-participate sa bidding.
That's our plan, sir.
Oh, then your plan. Okay, when is it gonna be implemented? And I want it implemented immediately. Kung talagang
Yes, sir. Maybe next year, sir, because we have to make sure.
Exactly, para makatipid ng 250 million ang taong bayan.
We have to
Para
make sure,
makatipid
sir.
ng 250 ang
Yes, sir.
kaban ng bayan.
We have
Okay, if you go, bring it back to your people, your dietitian will prepare the food, malaking tipid sa gobyerno.
I have to make sure, sir, that the dietetics and nutrition department is up to it, meaning
They're up to it. You just, galing po sa bibig nyo, sir, na ang problema na ay pilferage. You never said it was because of nutrition.
I mean-
you never said that.
Yeah, I mean, sir,
Pwede natin ulitin, you recorded to.
I mean, sir, how they prepare the food. May mga gamit po ba sila? May cooking utensils po ba sila?
Then bumili ka, kasi
That's the reason why for preparation.
oh, come on.
Even the
guys.
facility, sir. Even the facility.
No, kaya niyo po. Kasi nga po, itong mga, yung outsource ninyo, di ba, nagpe-prepare sa loob ng NCMH?
With their gamit po.
Oh, then, napakadali naman, bumili ka ng mga gamit na kailangan para ito mga dietitian ninyo na ang magpe-prepare ng food, nandoon pa, mas malinis pa, mas mapagkatiwalaan pa, because they are the dietitian and they know better than all these outsourced people na hindi nyo kilala kung sino sila, kung
They
saan
have-
silang galing.
No, sir.
No, sir. No, sir. No, sir.
They have their own dietitians, sir, of course.
I know. Pero sir, don't you trust your people at NCMH para ikaw pa yung mag-outsource?
Their mandate has drastically changed, sir, in preparation of food to monitoring.
No, sir. Marami kang palusot. Sorry, excuse me. No, I'm not
Yes,
gonna
sir.
accept that. Sir, the only reason you said, narinig ko sa'yo, you fixed it, you thought it was broken, ay dahil sa pilferage. Now, sinasabi ko na sa'yo, kung pilferage lamang, ayusin niyo po yan.
That's one of the problems, sir.
Exactly. Ayusin yung pilferage na yan para mabalik ulit yung sistema na doon niluluto sa loob ng sa gayon, sa loob ng NCMH, nang sa gayon makatipid po ng by the hundreds of millions ang kaban ng bayan. Correct, sir? Umuwi ka na kanina.
Yes, sir. We will look into it, sir. And I'm giving my word, sir, that this would be thoroughly thought out
Okay.
with the main thinking that for the benefit of our patients.
Very good. Thank you, sir. Now, nung pumunta po ako sa NCMH, yung mga pasyente po, sir, nakahiga sa sahig. Wala man lang banig, walang kumot, walang unan, walang kama. Kaawa-awa sila, Mr. Chair. Nakahiga sa sahig. Walang ventilation. Mamaya na yung ventilation. Nakahiga sa sahig. Nasaan na po yung budget para sa isang pasyente, bawat pasyente na meron silang dapat kumot, unan at banig? What happened to that?
First and foremost, sir, the pavilion that was being in the issue is Pavilion 4. It's highly congested pavilion. And if I put beds there, sir, hindi magkakasya yung total number of patients dun sa buong pavilion.
Then, overcrowded sila. You're admitting to me now that they're overcrowded. Kung overcrowded sila, so bakit hindi ka gumawa ng paraan na para i-decongest?
Yes, sir. Actually, sir, the plan to decongest has always been there, sir.
Always been there. Since when?
Because
And when it's going to happen na hindi that decongested
Yes,
na
sir.
sila?
because
How long you been the medical center chief sa NCMH?
I was appointed, sir, January 2021.
2021. So, 2 years ka na, hanggang ngayon pa rin na-decongest. Alam mo pala, from day one na pumunta ka doon, from the get-go, na congested na pala. Why didn't you decongest?
The decongestion of that Pavilion 4, which is the forensic pavilion, entails a lot more, sir. I have nothing to do with the admission, nor have I anything to do with the discharge, only recommendatory.
Yes.
Because the patients there is admitted through a commitment order from the judge. So I cannot refuse admission. So it keeps on.
Okay,
keep
sir, not
fighting.
only sa
Yes.
forensic ward, pavilion pumunta ako, kundi sa ibang pavilion, wala pong kumot, nakahiga po sa sahig. Tapos ngayon yung sahig na hinigaan, may ihi. Nakita ko po with my own 2 eyes. I was there. And you know that, right? Nakahiga, wala pong banig. Sa tabi niya, ihi. Okay? Walang kumot, walang unan. Okay, meron nga mga pavilion doon na hindi po congested. In fairness to you, okay? I was there. Bakit? Nasaan na po yung supply niya na banig? Nasaan ang supply na unan noong mga pasyenteng nakita ko doon na nakahiga sa sahig na walang saplot, walang unan, walang kumot. Alisin ng kumot dahil sobrang init eh. Wala man lang unan at wala man lang banig. Ano nangyari?
Actually, sir, I was there with you during your rounds.
Correct.
And I was
Thank you.
answering your questions during that time. And I stated that at night time, these patients are being given banig for their, we made our rounds kasi, sir.
At night time. Okay, madaling sabihin at night time
Yes, sir.
because nobody was there to check, to verify, to confirm yung sinasabi mo.
Yeah.
Ang importante, sir, dapat whether night or day, kapag nakahiga yung mga pasyente, nandun dapat yung banig na kung saan sila ay, di ba?
Pavilion 4, sir, right now, after your visit, has
Nandun yung mga banig.
we have decongested it. We have opened a new
Okay.
wing.
Yeah, I was informed.
Yes, sir.
Thank you
And,
for that.
yeah.
Pero again, let's go back to the banig and kumot. Bakit wala pong banig at unan? Bakit po sa sahig at nakahiga? Nakita mo naman, nandun tayong pareho, di ba?
Oh, yes, sir.
Oh.
That's why, sir, I was explaining to you during that time.
Not only sa Pavilion 4, sa ibang pavilion din pinunta natin, wala pong banig, sir.
I was-
Dr.
Yes,
Reyes.
sir. Yes, sir. I
Wala.
was explaining to you that time that if the whole day nandun yung banig, nandun yung kumot, it's a source of away because nag-agawan sila. At pag ang isa nag-soil sa floor, yung mga banig soiled. So, ang ginagawa po because of the limited manpower, at gusto namin talaga malinis ang hinihigan nila, At daytime, tinatanggal po ng mga nurses yan, yung mga banig at saka mga kumot. Nililinis po ang ward prior to bedtime, binibigyan po sila ng tigi-tigisa para pagtulog nila malinis naman.
No, sir.
Opo.
Dapat ganito yan. Kung ang palusot mo ay sa gabi lang sila binibigyan ng banig dahil nagsusoil, then why not buy 2 pairs of banig and 2 pairs of unan for each patient para kapag nasoil yung isa, meron papalit na isa habang nilalabang yung isa. Ikaw naman.
Okay, so,
Kung gusto, maraming paraan. Kung ayaw, maraming dahilan.
hindi naman.
Come on, sir. No, kasi it's a pitiful sight to see these patients na sila ang dahilan kung bakit po kayo nandoon. At kaawa-awa ang kanilang kalagayan, kalunos-lunos. Pagdating ko po sa inyong tanggapan, leather seat, drapes, mabango, and all. Pero hindi mo kasalanan to siguro, of course. And yet, these patients na yun ang bumubuhay sa inyo doon, kaawa-awa sila. Now, let's move on. Basketball court, tennis court, o napapikit ka, pinarerentahan niyo po.
No po.
Inamin niyo po sa akin doon, ngayon babawiin mo na. At least dito open.
Inamin ko po sa inyo that there's a proposal for the hospital rates which did not push.
No, you said, kukunin ko ulit yung video.
Opo.
In fact, ang nagsabi sa iyo, proposal pa lang,
Oh.
sabi po nung alipores mo. Pero ikaw na mismo, sinabi mo pinaparent 1,000 per game.
Proposal po.
No, you said pinaparenta. Now, sir, bakit kayo magbibuild ng basketball court at tennis court para ipaparenta? Sinong gumagamit ng tennis court? Don't tell me yung po'y ginagamit ng mga pasyente. Tennis court para sa pasyente, basketball court, pagganda-ganda ng gym. Wala akong nakita pasyente doon.
You asked Senator for a logbook of the patients that are utilizing the gym, and I provided you with.
Well,
such a-
yes, sir.
Yeah.
But you just gave me a name, but yung name na yun hindi pa verified kung talagang pasyente sila, kung talaga sila talaga yung sinasabi mong sila.
Yes, sir.
Unverifiable pa yun. Anybody can just come up with names at pwede isulat doon ng kung sinong Poncio Pilato, Herodes, Barbara, diba?
It is being used, sir, by the patients and during their activities.
No, sir. Yung facilities dapat sa loob ng NCMH. Hindi po pwedeng ipagamit sa iba. Let's move on. Parking. Maraming mga nakapark doon. I've heard. And I've got some proof. Maraming mga nakapark doon, mga sasakyan sa loob ng NCMH. Private individuals using the spaces of NCMH to park for a fee.
It's true po during siguro pang past 2 years, but we have
No, even now, and I have proof, and I will provide proof sa susunod na hearing.
noted, sir. Provide me with the proof, sir. Pwede ko nang silang paalisin if nakalusot.
Paalisin. In the first place, dapat ninyo pinayagan pa from the very beginning, sir.
There was a memo, sir, talagang hindi natin pinapayagan yan.
Tennis clubs. Oh, may tennis club pala ang nagre-rent.
No, sir.
Anong pangalan po ng tennis club?
Before Dr. Cortez time,
Paul Cortez na naman.
before po, sir, before.
Okay.
Ibahin ko na. During Dr. Vicente time,
Dr. Vicente.
yes, sir, there's a tennis club inside NCMH. It was funded, the building of it was funded by Mandaluyong. Now, sir, nung time niya, no, tinanggal na yan to make way for a general hospital, a building of a general hospital. And since then, sir, there are no tennis club in NCMH.
Okay. Sir, ang talagang labis na nakakabulabog sa akin, bukod doon sa pagkain and sa welfare ng mga pasyente, ay yung pong lupa ng NCMH paliit ng paliit kasi pinamimigay po, pinapayagan po ang mga tao na gustong magtayo ng proyekto dyan dahil kumikita po yung pumapayag. It might not be you, just like you said, naghugas kamay ka. Ngayon, kakausapin natin later on, yung mga pwedeng makausap na tauhan ninyo. But you are the boss. As such, you call the shots. You can tell them, hey, I don't like this, stop to. Pwede ka magpa-imbestiga. Bakit merong eskwelahan dito? Bakit may mga pinapatayo dito ng mga multi-purpose building? Dapat, sir, kung talagang kayo po ang boss, pwede niyo pong pigilan yon. Tulad ng nung pumunta po ako doon, di ba, may mga nakita akong kakulangan. In fact, if you remember, doon po sa isang mabahong, yung una kong pinunta ng ward, sabi ko maglagay tayo ng pabango. Sabi mo, pag-iisipan mo pa, di ba? Sabi mo, baka makaka-apekto sa kalusugan. Di ba? Sabi ko, pwede bang paano maapektuhan sa kalusugan yung isang pabango na ilalagay natin? So hanggang sa nag-comply po kayo, and thank you. Ang ngayon, pagpunta namin, mabango na.
The one that was put in place are humidifiers and exhaust fans.
Kaya nga.
So there are no perfumery brand that was or air fresheners that was.
Well, whether you put air freshener or hindi, at least naglagay kang humidifier.
Yes, sir. And
Dahil kung hindi po ako pumunta doon, kung hindi po ako nag-inspect, para pong baboy, tangkal ng baboy po yung ward na yon. Even nung pumunta ako, Mr. Chair, malakas po yung sikmura ko sa amoy. Hindi ko pa matiis, kaya nga kung napansin nyo, pumasok na po ako doon sa loob at nakita ko po yung kalunos-lunos na sitwasyon ng inyong mga nurse na nandun sila sisiksikan because sila din mismo hindi nila kaya sa labas. But anyway, that's besides the point now dahil nagawa niyo na po ng paraan. Tama po.
Notice, sir. Thank you, sir.
Now, yung pong Octan Builders, hanggang ngayon po ba ay yan po ay pinapayagan yung makakuha ng kontrata sa inyo?
As far as I am concerned, sir, since I took over, in the bidding process, they have not been joining the bidding process.
Okay, that's good. Yung kaso pong isinampa sa ombudsman laban po doon sa mga in-expose ni Dr. Roland Cortez, na-dismiss, tama?
Na-dismiss po sa
Yung ilan?
ombudsman, yeah.
Yes. Pero sabi sa ombudsman, wherefore, these criminal and administrative cases are hereby dismissed without prejudice to its refiling should the evidence warrant. So bakit hindi niyo po ni-refile? At bakit hindi kayo nagkalap ng ebidensya? Makakuha po kayo ng mga ebidensya. Would you like me to help you?
Yes, sir.
Para ma-refile? I will.
Hmm.
Trust me. Sige po. Magbibigay ako ng mga karagdagang ebidensya para ma-refile to.
Yes, sir.
Kawawa naman po itong, bukod sa kawawa po yung NCMH, mga pasyente, kawawa naman po itong memory ni Mr. Cortez.
Correct, sir. I agree, sir.
Last na lamang po. Kayo po ba'y seso?
Hindi po.
Di ba yung posisyon nyo dapat seso?
Hindi po.
Hindi ba dapat?
It's not a requirement of the civil service po and the Department of Health for a medical center chief to hold a CESO.
Ano po kayo? Director,
Medical Center Chief 2 po.
Medical Center Chief 2. So hindi po kailangan seso yan.
Hindi po kailangan.
Are you sure about that?
Yes, sir. You can ask the.
Then we will know siguro in the next hearing. I will reserve some of my questions, Mr. Chair, later.
Senator Win. Anyway, before Senator Win, our majority floor leader, Senator Joel Villanueva, would also like to insert his opening statement into the records of the committee. Go ahead, Senator Win.
Thank you, Mr. Chairman. Mr. Chairman, I'd like to direct my questions to the DOH, and I would like to thank the DOH for their presentation on the updates on the implementation of R.A. 11036 or the mental health law. I have some basic questions just to put everything in context. No? Do we have a hotline where mental health patients can call? Meron ba tayong hotline?
Yes, Mr. Chair, and it's being managed by our National Center for Mental Health.
And there's what's the number of the hotline? Just to, out of curiosity.
Yeah, 1553 is toll free.
1553. 1553. So if you call 1553, patients who are encountering mental health issues can reach professionals and
Yes, sir.
they can be diagnosed through that hotline.
They will be first entertained by our responders, crisis responders, and if there's during the course of the interview, if there's a red flag, then they would be coursed through a professional, a psychiatrist or a psychologist.
For the country, there's only one mental health hotline?
The National Center for Mental Health has been implementing this crisis hotline since 2020. And I do think, sir, good Senator, that some of the regions already have this hotline.
Okay. I know for a fact, just a
Iloilo, I think,
cursory
Mm.
search in the internet, there are other crisis hotlines. No, some of them are run by the private sector. No,
Maybe at
suicide
even schools,
crisis
sir.
hotlines, Hope Line,
Yeah.
Tawag Paglaum, Centro Bisaya. So there are other hotlines. No, and I'll go to that later on. No, but just to put on record, there are other hotlines by the private sector. But for government, there's only one, the 1553.
Three. Yes, sir.
Tama po ba?
Yes, sir.
Okay. How many? May PGH pa pala. There's a PGH, Amang Rodriguez,
And some schools, Senator.
and some schools.
Yeah.
Okay. How many cases did we receive this 2021? How many calls did you receive?
I just look at the.
For 2021, just for 2021.
For 2021, there were around 21,468 calls, of which 7,600 are suicide-related calls. So
So
that is around 30 to 40%.
So in 2021, there are about 21,000 calls received, of which 7,000 are suicide cases,
Related
suicide-related
calls.
cases. Do you know, have you followed up with the suicide-related calls?
It is mandated by the institution for the responders really to follow up.
Okay, and
If-
what are the results? Are we successful in thwarting suicide calls, suicide-related cases?
Yes, sir. Majority of them have been managed now with specific treatments like antidepressants or have been undergoing counseling. No?
Mm.
And some of them, of course, meron din porsyento na lost to follow up, yung hindi na tumatawag.
And how many of those, do you have the age breakdown of those calls?
Yes, sir. In terms of age distribution, less than 17 years old accounts for 4,800.
Out of the 21, or out of the 7?
Out of the 21, sir.
So 4,000 cases out of the 21,000
Yes, sir.
are below
Because
17.
they are clumped here, sir,
Oh.
Senator. But anyway, majority of the callers falls between the ages of 18 to 30.
Now, how many, out of the 21,000 calls, how many are below 17?
4,800.
So 4,000 are, so that's
Quite a bit.
That's quite a bit.
Yeah.
No? How many is below? How many is between 18 to 30?
It's not specified, Senator, but I think
What is the biggest age group na lang?
that age group, sir, 18 to 30.
18 to 30?
Yes, sir.
How
That's
many
the
calls?
majority of the calls.
How many calls are
Sir,
those?
it's not specified. Yeah. The math seems wrong, sir. So
No, you have 4,000 out of the 21,000 are below 17. So that's more or less about less than 10%.
yeah.
Tama ba? No, sorry, that's more or less about um,
4%.
ako. That's about 20% are below 17.
Yes, sir.
So that's significant.
Quite a bit, sir.
Okay. And then what are the next age group?
18 to 30, sir.
How many percent is that?
It says here around With your indulgence, Senator, I'll just have it confirmed.
52%.
No, because in the, we looked at the DOH Facebook page,
Mhm.
and it's around
60%.
60%. You know? So in other words, if we add your number in 20% plus 60%,
80
80% is below 30
years old.
years old and below.
Yes, sir.
No? And these are the, I will call, working age.
Mhm.
And some of them are school age. No?
Yes, sir.
20% are school age. These are high school students and below. No? But I want to also go deeper. How many of, sana naman wala, no? I hope it's zero. But do you have any reported suicide cases out of those incidences of suicide? I hope zero.
Yeah.
But do you have any?
We don't have that data at the moment, Senator. But I would gladly ask them to provide you with one.
Oh, provide, no? Because it's important
Yes,
also. What I'm driving at is, are we reachable? No?
Oh,
Can people reach us?
yeah.
No? And then number two, are we analyzing the data?
Yes.
Because I will go into later on some of the preventive measures that we are implementing, whether it's enough or not enough. No? And then number three, are we thwarting suicides? Are we preventing suicides? No?
Mm.
So those information are important. That's why in our hearing in the Basic Education Committee, those data were called precisely to know whether we are doing enough or not doing enough in terms of mental health. So just provide us with the data, but obviously it's quite concerning that 20% of your calls are below 17 years old, meaning they're teenagers, and then 60% are between 18 to 30, no, which is the early working age.
Yes, sir.
And so that's number one. But nationwide, that's only with your hotline. Eh. But nationwide, sa DOH, do we have that numbers? How many calls do we get nationwide?
So, Mr. Chair, we don't have the numbers
How
for
come
the
you don't
private
have it?
sector.
O nga, how come we don't have it?
The plan po is to expand the government-led hotlines through our regional networks. And the NCMH is already ongoing training for that. But for the privately led ones, we'll have to coordinate with the DOLE how to get those information.
But what-
Senator, we will in the future, because hotlines will be connected now to NCMH as the reference center. So all these hotlines now we will work on being connected to NCMH so that we could come up with a nationwide census or data.
Yeah, but it's important also to get the nationwide data.
Yes, sir.
So we know whether the entire country is doing enough to prevent mental health. And are we getting reports accurately? Sa inyo lang ho yan, sa inyong center. But what about the other centers? And what about the private sector?
Yeah.
I'm sure they're getting calls also. They're probably getting more calls. No? But are we consolidating it and analyzing it? Are we doing that, Dr. How?
Currently, sir, our nationwide data has been based on surveys, and that has been guiding our poly responses. But well noted, sir, on the recommendation. We'll
I-
make sure how to get
We
those
should start
information.
consolidating all of these calls so that we will know whether we're doing enough or not doing enough. Yun lang naman ang punto natin. Eh. We have a law, but we don't know if the law is effective or not. We have a law, but we don't know if we are implementing it to the letter or not. No? And I saw again in the website of the DOH, you know, apparently in 2019, itong actual suicide. Itong actual.
Sir, I got it from PSA. That's from PSA.
Oh, okay.
It's more than the calls.
Yeah. Okay. This is we got this from the DOH Facebook. you reported this, no? I don't know which, I think this is from the National Center for Mental Health. In 2019, you got 3,000 calls. In 2020, you received 11,000 calls. In 2021, you received 14,000 calls. So in 2020, the number of calls tripled. So in
Pre-pandemic-
2021, the number of calls quadrupled. Why is that?
That's pre-pandemic and pandemic.
I know.
Yes, sir.
Are we doing anything?
Yes, sir. That's the reason why the expansion of the hotline numbers becoming toll-free. Before, sir, it was cell phone numbers, and now they are the hotline now is accessible through landline and mobile phones.
No, but other than the numbers, other than the hotline or numbers, what are we doing to prevent it? What are we doing to prevent incidences of suicides? What programs, what intervention programs are we doing? For example, I'll give you again, this is from your Facebook account. No? In 2019, reported suicide calls, 712. In 2020, 2,821. No? So that's more than 3 times. In 2021, 5,167. No? So from 2019, 721 to 2021, 5,000.
So in NCMH, in the National Center for Mental Health, our responders now are
Alarming. I'm alarmed.
yes, sir.
The COVID created a lot of damage, not only to our economy, but also to our mental well-being. And my question is, what are we doing?
We have strengthened our 24/7 crisis hotline. We have trained our responders in terms of suicide prevention. And we are continue capacitating and training other agencies that are requesting for us to be trained in terms of suicide prevention and mental health wellness. So we continue, sir, to provide training to other agencies that are requesting for wellness programs. No, sir. Truly, sir, I agree very much that they say that the next pandemic is mental health.
It's already here.
Yeah.
The pandemic of mental health is already here
And that's the reason why, sir,
in our
we are-
country.
That's the reason why, sir, we're enhancing all our service capabilities and service provision to these patients.
My staff just sent me a research from the PSA. No, we do the we call data from the PSA. In 2019, the reported suicide cases is 2,810. In 2020 is 4,420. 2021 wala pa, no? So just because of the pandemic, the suicide cases went up twice. And the amount of calls that you received through NCMH is only 2,800 number of calls in terms of suicide-related cases. In other words, maraming tumatawag sa inyo, pero tumatawag sa inyo 2,800, pero nagpakamatay 4,400. There are more unreported suicide cases.
Mr.
So what are we doing? It's the pandemic of mental health is already here.
Mr. Chair, to add to what Dr. Noel has mentioned, recognizing this importance nga po, we are developing other platforms to reach people. The first of which is the self-paced mechanism, the Lusog Isip app we've developed with USAID. This has already also been piloted into more users. Now we are around 12,000 users, but definitely there's still a lot more to be
Many
improved and
users?
reached. 13,000 po from its pilot launch. In addition po, yung at the local governments kasi ang isang important intervention din po talaga is peer support. And that's why yung pinakita namin kanina about the implementation of the peer support playgroup is also currently being piloted in a few LGUs. And we're planning to expand that next year to address nga po the reasons why people have suicide ideation in the first place. And kasama din po dito, Madam, Mr. Chair, yung importance nga po talaga ng school-based intervention. So aside from the pilot on the suicide prevention in schools that we've pre-tested this year, we're already discussing also with DepEd how to augment their capacity to this. And among our possible interventions po, and we've included it in our budget in the DOH, is actually augmenting the staff in schools, deploying some health personnel to be able to provide actually all of our health programs specifically in schools. So rest assured, sir, we're really figuring out alternative ways and more ways to catch different types of people also who are prone to
But
suicide.
Dr. How, Dr. Reyes, have you dissected who are these 4,420 who committed suicide in 2020? Have you looked at their demographics? Have you looked at the causes on why they decided to end their own life? Have you analyzed one by one as mental health professionals? Or numbers na lang sila na nagpakamatay na ito? Have you looked at one by one? What are the causes? Ano ba yung causes itong 4,420?
So, Mr. Chair, we get an aggregate report of
Yeah, I
some
know
of
it's
the-
aggregate, but you cannot aggregate life. Life should be looked at one by one. So have you analyzed the 4,420 to come up with targeted intervention programs? Wholesale kasi tayo, may hotline tayo, masaya na tayo, tumatawag. Pero mas marami nagpapakamatay compared sa tumatawag.
So, Mr. Chair, we have access to the data as mentioned, and we see some of the major causes, and some of our interventions have focused on these major causes. Among those, for example, in the hotline, it really are in regarding to anxiety, love relationship problems, asking for processes like where to go to, where to refer. Some of them also include problems in the family, or also concomitant non-medical health concerns. Some of them are about needing someone to talk to, and also problems about work and employment. And so these kinds of information po feed into what interventions we develop with the other stakeholders. So for example, because of that need to someone to talk to, that's why we have peer support groups. Because of the need for counseling on their points of care, that's why we also have workplace and school-based programs. But definitely, sir, there are a lot of room for improvement, and
Yeah, how about
we commit
but the
to-
4,420 who committed suicide in 2020, have we looked at each
Case.
individual, each case on why they committed suicide?
Not at the moment, sir, but we'll do that po. Thank you.
I think you should start analyzing data. You guys are supposedly mental health experts. We cannot just treat mental health with hotline and training. We have to look at each case and see what intervention programs can we deliver. No? Because what I'm getting right now, we're treating everyone wholesale. Hindi naman pwedeng wholesale yan. No? And from your own website, your own Facebook page, I'm already alarmed. No? Because the number of reported cases of suicide almost went up 5 times, from 700 to 5,000. We should already sounding the alarm bells. Pero in the data also, mas maraming napapakamatay kaysa tumatawag. And that's scary because people are now hopeless. They don't find any use to call the hotline. In any case, my recommendation is number one is to consolidate all of this information and study it carefully. Because what I'm getting right now, maganda yung presentation ninyo, but we're doing it wholesale. We're not analyzing the data, and we're not preventing it. Because based on, even in your own in your own website, in 2021, it's increasing. So we have to do something to decrease it. So just submit to us all the disaggregated data on calls, on reported suicides, even suicides. And we want to see the picture for the entire country, not only for the mental health center, but for the entire country. We need to see the bigger picture. And that's what's missing right now. So just submit to the committee for us to appreciate, and maybe later on, Mr. Chair, in the next hearing, to present to us the entire picture. Not only those that you are receiving from the mental health sector, but the entire Philippines. Yeah. Yung actual calls. I know that you conduct surveys, but yung actual talaga, because we will see the trend. Thank you, Mr. Chair.
Salamat, Senator Gatchalian. Wala na si ano, no? Wala na yata si Dr. Beverly. In the spirit of fairness, sana, gusto ko siyang, she wishes to respond to the allegations brought about. Ma'am, you have the floor, if ever nandyan ka pa, nakikinig ka pa. Dr. Noel, wala na po si Azucena. Nag-vlog out na siya. The spirit of fairness lang. Kung gusto niyang magsalita dito sa committee natin, pwede mo siyang tawagan. Hindi pa naman tapos yung ating hearing.
Mr. Chair, pwede mo
good.
kasingit?
Go ahead, Senator.
Kasi kanina, ininay ni Dr. Reyes at itinuturo niya si Dr. Cortez doon po sa kontrata sa food. Okay. Dr. Reyes, meron po akong kopya rito ng document January 2022. Hindi lang klaro kung anong date ito, pero January 2022, it says here, January 3. Okay, thank you. It says here na nirenew po ninyo ang contract ng 4A's Foods and Catering Services. Ito po yung sinasabi ko na renewal na lang at hindi na bidding. Now, granting na sabihin natin for the sake of argument, ang nag-umpisa talaga si Dr. Roland Cortez. Pero nakita niyo naman po na baluktot at illegal po yung ganong klaseng kontrata at sistema. Ba't niyo po binago? Bagkus sinakyan niyo po at pumirma pa kayo rito sa isang illegal na kontrata.
I'm just honoring the previous contract, sir, of 3 years renewable every year. However, sir, I agree, sir, and that's the reason why after the 3 years, I instructed the BAC to conduct a new bidding process for it. Para na yearly na, sir. Hindi na 3 years, yearly na. And that's the reason why, sir.
Sir, renewable lang po yung contract kung satisfactory po.
Correct, sir.
Okay, in this case, hindi naman po satisfactory yung serbisyo. So, dapat hindi nyo na po ni-renew. Kinancel nyo na po. At meron po kayong karapatan na i-cancel kasi nakita nyo naman po na baluktot po yung kontrata at hindi po tama. So, you have the authority na pakansilin po yung kontrata because illegal po yon. So, anyway, nag-agree na po tayo na from now on, ibabalik nyo na po yung pagluluto ng mga pagkain ng mga pasyente, babalik na po dyan sa NCMH at huwag niyo na pong gamitin tong outsource na tumataga po sa ating gobyerno by the hundreds of millions. So para makatipid po. Tama?
Yes, sir.
Okay. Good. And I really appreciate that. Sige, yan lang muna, Mr. Chair.
Dr. Reyes and sa DOH, no? Alam naman natin na hindi maikakaila na meron pa ring stigma sa usaping medical health, no? Kaya nahihiya talaga yung iba magpakonsulta at humingi ng professional help. At itong sa private naman, yung iba ayaw magpa-check up talaga dito sa National Center for Mental Health. Dahil pag pumasok ka doon at nakita ka, alam mo, magkakaroon talaga ng, whether we like it or not, takot sila na, oh, bakit ka pumasok dyan? Ako naman, iniinganyo ko po yung mga kababayan natin. Kaya nga tayo merong National Center for Mental Health. And in fact, isa po ito sa I am advocating for the establishment of specialty centers in DOH hospitals. Priority rin po ito ng ating mahal na Pangulong Bongbong Marcos. Mental health is one of the specialties which we aim to make accessible across all regions. Ibig sabihin ng specialty center katulad ng heart center, NKTI, yung lung center, na ilagay po natin sa mga DOH, existing DOH hospitals to make it accessible at ilapit po yung serbisyo medical sa ating mga kababayan. At kasama na po dito itong mental health. Kaya I believe that the DOH is planning to establish more than 20 mental health centers in DOH hospitals across the country. Ngayon, iniengganyo ko po yung mga kababayan natin na mag-check up po kayo. And then, meron nga pong malasakit center dyan. Pwede nyo lapitan yung apat na ahensya, PhilHealth, PCSO, DOH, DSWD para tumulong po sa inyong sa babayaran. Lalong-lalo na po yung mga poor and indigent patients. Ngayon, dito naman sa iba na ayaw talagang pumunta sa mental health hospitals natin. Gustong pumunta secretly or discreet lang na ayaw magpakilala. Pupunta po sila sa mga psychiatrist, for example. May tanong lang po ako dito na so that the public is aware. Yung iba kasi may mga health card, no? Halimbawa, dito sa Senado, may health card tayo. Papa-check up, may mga kumpanya, may mga health card sila. Narinig ko lang na yung iba ayaw tanggapin daw yung health card sa pagpapa-check up. So, nasa mga private doctors or physicians so ba ang discretion not to accept the health card. Kasi malaking bagay ito. Lalong-lalo na po sa mental cases kasi gusto nila medyo private talaga yung consultation eh. Ayaw nilang malaman. Ayaw nilang pumunta ng mental health hospital. Gusto nilang pumunta dun sa clinic para magpa-check up. Do you have any idea, Dr. Reyes, about this concern? I know na hindi mo directly masasagot baka may idea ka kasi related to sa health tong pinag-uusapan na sa mental health tong
Sir,
pinag-uusapan.
the PhilHealth packages of existing now for psychiatric illnesses, sir, I think the doctor beside me can really answer it best. But it covers acute psychiatric care inpatient. No, there's no coverage, sir, for outpatient. Yet, no coverage yet. But they are soon working on it, sir, Mr. Chair, to have a outpatient package that includes how many sessions of psychotherapy. With that, sir, we're working with the PhilHealth, sir.
Yung mga nag-private practice na doctors, may mga health. Halimbawa, yung empleyado ng Senado,
Yes, sir.
may health card siya. Pupunta siya doon sa private hospital, private clinic, meron siyang health card. Hindi ba pwedeng ma-charge yun sa health card nila?
Sir, I really have no idea with private health insurances if they carry psychiatric illnesses. What I can speak of, sir, is PhilHealth because the NCMH is also claiming for acute psychiatric care sa PhilHealth. And we've been, the claims are being entertained naman, sir, by the PhilHealth.
Maring may tanong na lang natin to sa paki-take note na lang nito since hindi masasagot ni Dr. Reyes tong issue na to. Anyway, ano po bang ginagawa at plano ng DOH para ma-improve ang mental health awareness sa bansa? Ano po bang mental health referral system natin sa ngayon? If someone is suffering from mental health issues, saan siya unang dapat lumapit? Yung sistema po, yung hotline, yung telecon, pwede ba nating i-explain ng mabuti sa publiko para hindi na sila kailangan pumunta kung nagkaka-experience sila ng mga depression at hindi naman ganun kalala, pwede naman silang bumili na lang ng gamot sa yung mga depressant na yung gamot, 'di ba? Merong mga iniinom na to pangpakalma sa kanila baka through teleconferencing na hindi na sila kailangan pumunta pa sa National Center for Mental Health. Or ano bang ginagawa ninyo ngayon, especially during disasters, calamities? Marami sa ating mga kababayan na stress at kailangan ng psychological support. Saan sila pwedeng lumapit na makakatulong kagad sa kanila?
So, Madam Chair, Mr. Chair, we have currently po, the first point of contact can really be your primary care provider. So that could be either the RHUs or your attending physician, and they can discuss with you. And yun po yung magbibigay rin ng appropriate assessment if you have to be triaged to a higher level of care. Yung ating local government-led po na mga RHUs, currently we're training all of them to be equipped with community-based mental health. That would include screening, assessment, and even the medicines that can be already provided at the primary
RHU
care.
is Rural Health Unit. Punta sila doon.
Ay, opo. But alternatively nga po, pwede rin po yung mga online platforms like yung app-based, kasi we also encourage yung self-based din po. There are people that can already be
Pwede nyo bang
managing.
mas maklaro since meron naman tayong budget para sa to address mental health. Maklaro lang yung hotline, alam nyo lang yung teki na, andyan lang sa cellphone. Ito dial or press ganito, ganyan. If you experiencing depression or something, pwedeng yun na lang yung pindutin nila para masagot ka agad at they will be guided accordingly.
Yes, Mr. Chair. We commit po to talk to our communications office to put all of these in the website and in the Facebook platform for ready information of everyone po. Thank you po.
Senator Tulfo.
Yes, meron lang po akong follow-up questions kay Dr. Reyes. Pasensya na, Doc. Naalala ko lang kasi kanina, nabilis tayo. Yung pong sa Sunshine Recovery, so, pakisabi na lang po kay Dr. Cuyes sa Dr. Avila na mag-divest. So sabi nyo, hindi po kayo kasali dito until such time makakuha ko ng dokumento. Pero confirm po na itong si Dr. Cuyes at Dr. Avila ay kasama po sa Sunshine Recovery, right? So this is conflict of interest. So pakisabi na lang na, Cuyes and Azucena. Pakisabi na po kay Cuyes and Azucena na mag-divest po.
I will, sir.
Okay? Now, noong 2016 po, nag-procure po ng CT scan ang NCMH, tama?
Yes, sir.
Okay. And lumitaw po na yung CT scan na ito ay bulok. Bakit po bulok? Dahil 50% lang po ang nababasa ng CT scan na yon, image. Now, sino po ang nag-procure noon, noong 2016?
Last 2016, it was procured by the National Center for Mental Health. po.
Yes, pero
Oo.
sino po yung nasa likod noon ang nag-facilitate? Hindi ba si Dr. Azucena yon?
During that time, Dr. Azucena was the OIC.
Yes,
Dr. Cuyos was the chair of the BAC.
correct. So at least either of the two
Mhm.
will do. O si Dr. Azucena lang. Sino po sa
I
kanila?
really have no idea who the director
Pero at that time, sabi mo po ay si Dr. Cuyos
is, the chairman
chief
of the BAC.
of the back. Okay. Now, kung ganun sir, irregular po yung pagka-purchase dito sa CT scan. In the name of delikadesa, di ho ba dapat hindi po na-retain ito, nabigyan po ng pwesto? Ngayon po meron siyang goods, services, and infra. Head po siya ng Bids and Awards Committee. Di ho ba dapat sa ngalan po ng delikadesa? Kasi kayo po mismo nagsabi na at that time, noong 2016 na bulok na CT scan na na-procure ng NCMH, at that time, ang head is si Cuyos, Bids and Awards Committee. And another thing pa sir, sama ko pa dito. So, si Dr. Cuyos po at that time ay nasa head, Bids and Awards Committee, right? Okay, head po siya nung panahon na yon na yung gumawa ng expose si Dr. Cortez, tama?
Yes, sir.
Okay, at yung ginawa niyang expose dahil kay Dr. Avila, right?
I really don't know Dr. Avila. There
No,
is
no,
a Mrs. Avila,
Clarita Avila.
yeah, which is the chief administrative
Yes,
officer.
okay.
during that time.
At yan po ay dahil may kinalaman doon sa anong pangalang kontrata? Yung contractor? No, yung Octan. Okay. Si Clarita Avila ay incorporator ng Octan na palagi pong napapaboran every year. Wala ka pa rito nun, sir. So
Wala
huwag
pa.
ka magalala.
Oh.
Napapaboran palagi itong Octan na incorporator po si Dr. Clarita Avila. Doon pa lamang po, sir, meron agad conflict of interest. Do you agree? Yes,
Yeah,
agree with me.
I
Kasi
guess,
incorporator siya
yes.
and incorporator siya ng Octan at itong Octan napapaboran po every single year sa mga kontrata. So right there, conflict of interest, right? Now, at that time, si Dr. Cuyos ang head ng Bids and Awards Committee, right?
Yes, sir.
Okay. Therefore, hindi niya ginawa yung trabaho niya. Kung ginawa lang niya yung due diligence, nag-check siya, tinatawag na pre-bidding and post-bidding screening, nakita niya na, teka muna, itong palaging pinapabura natin ng Octan, ang incorporator nito pala ay kasamahan natin. Huwag natin ibigay dito sa Octan. And yet, tuloy-tuloy binibigay sa Octan. At nung may nag-expose, pinatay. So di ho ba sa ngalan ng delikadesa, hindi mo na dapat pinaupo itong si Dr. Cuyos, bagkus sana inassign mo sa malayong lugar o ibang pwesto, wag lang po sa Bids and Awards Committee again.
Sir,
DOH, of course, sinabi mo, but you have the right na para i-recommend
No, sir,
na wag
the,
nang bigyan
the
posisyon.
issue in terms of the procurement of the CT scan, sir, I really cannot find any yung 50% na sinasabi niyo, sir, good senator, because it's a CT scan, not a X-ray machine. It is a CT scan.
No, kaya yung CT scan, di ba 50% lang imagery noon?
There's no
nakikita?
such thing, sir, as a 50%
No,
of it.
no,
It's always 100%, sir, in terms of the technology. However, sir, yes,
Okay, that's debatable. But anyway, later on sa susunod na
Yes, sir.
hearing, we will produce some documents to
Yes, sir.
state na talagang merong ganong klaseng katiwalian na itong
The-
CT scan ay 50% lamang po ang imagery na nakikita rito. Okay. Now, bumalik tayo dito kay Dr. Cuyos. Bids and Awards Committee siya chair at that time. And pinalusot niya, pinayagan niya makalusot ito pong Octan na ang isa sa mga incorporators ay kasamahan nila. At walang iba kundi si Clarita Avila, Chief ng Administrative Office. Hindi niya ginawa yung trabaho niya. Kasi kung ginawa niya yung trabaho niya, nasilip niya, nakita niya na hindi pwede ito, conflict to, ba't natin papayagan to Octan? Di ba tama? You agree?
I really cannot say anything
Why not?
of which I am not privy to po, Senator.
No,
During
pero,
that time,
pero alam niyo po na itong Octan equals to Clarita Avila. At mayroon pong mga records to show na si Clarita Avila ay incorporators ng Octan at that time. Alam niyo po yun, hindi?
it was during the time, sir, that I
Because si Cortez pa yon.
no, sir. It was during the time, sir, that I browsed upon the documents pertaining to the complaint of Dr. Cortez when I saw that one of the incorporators was Ms. Clarita Avila na
Yes.
nakasign.
Yes.
And during the time that it was given to the ombudsman for its processing of the case, I saw and I read in one of the documents that Ms. Avila stated that she divested already all her accounts in this octant since 1999. I am no position, sir, to because I'm not a legal person, but these cases have been filed to the ombudsman, of which I have no power.
Sabihin po natin na divest na po siya. The fact na dati po siyang incorporator, so therefore meron pa rin po siyang connection sa Octan. Na sabihin natin, going by what you are saying, na ganun nga po yun. Okay? And later on, it will be proven by documents. Sana man lang, sir, in the name of delicadeza, I've been saying this all along, kanina pa, sana hindi po nabibigyan ng ganung sensitibong posisyon itong si Dr. Cuyos. Binigyan po siya 3 posisyon. Goods, services, and infra. Now, nasan po si Dr. Azucena? Wala na po siya, malis na.
Can I clarify, sir, the Bids and Awards Committee? Yeah, you're correct, sir. Goods, infrastructure, and of course yung consultancy. Infrastructure, sir, is the chairman is Dr. Vic Puntavela, not Dr. Cuyos.
So wala na si Cuyos doon.
Wala na.
Since when, sir?
I cannot recall, sir, where I issued the hospital order for Dr. Vic Puntavela.
Okay, so
And then-
pinilitan po siya ni Pontabela.
And then Dr. Cuyos is relegated, of course, to the other two, the consultancy and the goods.
So ano pong hawak ngayon ni Dr. Cuyos, sir?
For the goods and the consultancy,
Goods and consultancy. Okay. Ano po yung covered ng consultancy, sir?
for highly technical consultancy jobs that the present manpower complement of NCMH could not handle, we outsource it. And
Exactly. So like the food.
the food, sir, is in the group.
Outsourcing of food. Is that under Dr. Cuyos?
Yes, sir.
Okay. Now, alam niyo naman po, sir, na isa po siya sa head ng Bids and Awards Committee nung sumabog po yung expose ni Dr. Cortez. Ang sa akin lang po, sa ngalan po ng delikadesa for the end time, you should have said, pare, hindi mo na kita ilalagay dyan. Ibibigay ko muna sa ibang posisyon, not that position. Plus, meron nga pong mga balibalita na itong dalawa, si Dr. Cuyos at Dr. Azucena, ay sila po yung magkarelasyon. Again, I don't have anything against the relationship. Who am I? Na para i-judge sila tungkol dun sa kanilang personal na buhay. That's none of my business, right? However, it becomes the business of everybody kung nagagamit nila yung kanilang relasyon para sila po yung makasagawa, makasakatuparan nila ang mga pagmamagic-magic dyan sa loob ng NCMH. That's my point. And you're denying na hindi. So therefore, ibabalik ko, ito pong tinitirhan ni Dr. Cuyos na cottage ngayon. Kanino po nakapangalan?
National Center for Mental Health.
Kaya nga pero kanino pong name talaga mismo?
I have to confirm, sir. It has been assigned as a cottage for Dr. Cuyos
Kaya nga, ito,
kahit nung wala pa.
pero kanino po talaga mismo nakapangalan?
I will check, sir. I will check, sir.
And if you will check, most likely, baka makikita mo doon ang pangalan ni Dr. Beverly Azucena.
Mm.
Yan po yung sinasabi ng mga source ko
Mm.
sa loob mismo ng NCMH. Now, if you connect that 1 plus 1 equals, you know what? Right? Sir, ito po yung point ko. Paiksin ko na, tapusin ko na talaga to once and for all. Nung kayo po ay dumating dyan sa NCMH, marami po kayo nakita mga katiwalian, kalokohan, kabaloktutan. Granting to itong sinasabi nyo, meron po mga in-implement dyan si Dr. Cortez na mga hindi tamang sistema. Mali. You have to correct it. You're now the boss. You're the head. And you can make those corrections. Kasi nakita mo na mali. Bakit mo ipagpapatuloy? Eh mali na nga. Di ba? And my recommendation to you, for God's sake, itong mga alipores mo, na mga kaibigan mo na you go a long way, please, saka na po yung kaibigan. Unahin po natin yung serbisyo sa bayan, yung kapakanan ni Juan, especially yung mga pasyente niyo dyan. Huwag niyo po muna ibigay itong mga sensitibong posisyon sa mga tao na noong mga panahon ay nasasangkot, na involved sa katiwalian. Marami pa naman pong taong qualified eh. Sila lang ho ba ang qualified? Of course not. Marami pa pong taong magagaling dyan sa NCMH na matagal na dyan sa NCMH. Tumingin-tingin lang po kayo. Buksan niyo po mga record niyo. Tingnan niyo po yung record sa HR. Marami pong mga capable, able na mga empleyado dyan sa NCMH na kayang i-take over itong posisyon ni Cuyos at saka ni Azucena.
Sir, if I may be allowed,
Now, sinasabi sandali, last na sir. At sinasabi nyo kanina, kasi ang naglagay dyan DOH, right? Okay, kung ang naglagay DOH, then meron kayong recommendatory power since you're the chief na para sabihin, wag na muna yan, meron kayong recommendang bago. And I'm sure DOH will listen to you. Maliban na lang kung may connection sila sa DOH, maliban na lang kung sila ay nagbabayad ng pera sa DOH, maliban na lang kung kasabot ang DOH sa kanilang mga katiwalian. Then kung hindi kasabot ang DOH sa kanilang katiwalian, kung hindi tumatanggap ng tong ang DOH mula sa dalawang ito, then DOH will definitely listen to you and do as what you say na palitan sila at maglagay ng bago in the name of delicadeza. Am I right?
yes, sir.
Thank you.
If I may be allowed, sir, since I took over the medical center chief position, I'm very strict in implementing the regularity of functions in this hospital. I really like to change the operation, the core processes, the systems that the staff had been used to.
Okay, you want to change it.
Yes.
Start with Cuyos and Azucena.
That's what
Change them.
That's what I'm
Replace
getting.
them.
That's what I'm getting at.
Thank you.
Senator. That,
So, maasahan ko po ma-replace na itong dalawa.
sir, that ever since I took over and the strict implementation of the regularity of function, trabaho lang, sabi niyo nga, sir.
Yes, sir.
I have seen how they work, Dr. Azucena and Dr. Cuyos, and I vouch for their integrity and
As a friend.
as a healthcare worker.
Because you know them for a long time. You go a long, long
Yes, sir.
time.
As a healthcare worker and in that position, they are the most qualified and they are performing very well, sir.
Sir, they're not the only ones qualified. And sinabi ko na sa iyo kanina, involved po sila sa mga katiwalian.
Yes, sir.
Okay, if you were in my shoe, at yung mga tao ko, isinasangkot sa katiwalian, hindi ko na po bibigyan ng posisyon. Mahiyahiya na po ako sa balat ko. Kasi kung hindi, babalik sa akin yon. Sasabihin ng mga tao na kaya mo punesto yan dahil it's either kaibigan mo o naikinabang ka. Kasi kung hindi ako naikinabang at hindi ka naikinabang, alisin mo talaga yan. Eh bata, hindi lang naman ikaw kaya dyan. Pasensya ka na, alis ka na muna dyan. Maglalagay ako ng walang dungis, ng hindi pinagbibintangan, na hindi pinag-iisipan. Itong dalawa pinag-iisipan eh. Pinagbibintangan. At may mga ebidensya pa in some cases. Ebidensya na kapabayaan because they didn't do due diligence. Nakalusot ang mga katiwalian because pinabayaan nila makalusot at wala silang ginawang pagre-research. So therefore, kung ako sa iyo, sir, hindi lang naman silang dalawa ang qualified. Kung talagang totoo sinasabi mo, gusto mong baguhan sistema dahil gusto mong maging maayos ang pamamalakad dyan, good governance ang gusto mong pairalin, then walk the talk.
I will, sir.
So, when you say you will, so titingnan mo po, reviewin mo po itong performance ng dalawa, not as a friend, but as the chief, medical center chief of NCMH, na ikaw po ang ama ng lahat ng empleyado dyan at maging patas po ang turing mo sa iyong pamilya, kapamilya dyan bilang mga trabahador.
Yes, sir, I will do it.
Review that, sir. At makita po, sana sir, makita niyo po yung liwanag, mailawang kayo, at makita niyo na talagang dapat merong pagbabago. And I trust, hindi ka pa naman hopeless, sir. Nakikita ko, sir, na meron pa rin kabaitan, meron pa rin kagandahan loob sa iyo. You know why? Honestly, I'm not being sarcastic. Kasi nung may nakita akong kamalian doon at sinabi ko sa inyo, baguhin niyo, binago niyo, sir. And for that, I commend you and I salute you for that.
Thank you, sir.
Remember? Marami akong mga tinuro sa inyo na baguhin, binago niyo, sir. Totoo yan. And I sincerely thank you for that. Binago mo. Nakita mo mali. Wala nang cheche-boreche, pinalitan nyo. Now, here we are, much bigger, para sa kapakanan po ng mga pasyente. Maggawa kayo ng pagbabago, umpisahan nyo po dito kay Azucena at sa kay Cuyos. Maasahan po natin yan, maasahan ng taong bayan. Thank you po, Dr. Noel Reyes, sir. I rest my case, Mr. Chair.
Salamat, Senator Tulfo. One question lang po muna. Itong sa Mental Health Act natin, no? The implementation of the Mental Health Act is being guided by the National Mental Health Strategic Plan 2019 to 2023. As we are already in its final year, what are the goals achieved in the implementation of the plan? We have to implement the mental health law across various stages: health promotion, prevention, screening, diagnosis, treatment, and rehabilitation. On the aspect of health promotion, are the primary care facilities capable to promote mental health? Under the law, LGUs with technical assistance from the DOH shall be responsible for the training of barangay health workers and other barangay volunteers on the promotion of mental health. The DOH shall provide assistance to LGUs with medical supplies and equipment needed by BHWs to carry out their functions effectively. Is the DOH able to comply with this? Ito pong sa ating Mental Health Act.
Thank you, Mr. Chair. Yes po, especially for the first phase of our strategic plan, a lot of it has focused on building it po, building the training modules, building the frameworks, building the access program. So right now po, we have limited implementation of our community-based mental health program. Yun po yung nagtuturo nga po yung mga barangay health workers, nagbe-build sila ng network with the RHU. And may corresponding medicines po, the ones that we procure under the access program. But rest assured po na nag-start pa lang po kasi tayo sa building up phase. In the incoming next strategic plan po na 2024 to 2028, for that will be developed by the Council for Mental Health. At community-based talaga po yung ating vision, and yun yung strongest pillar na gagawin po natin in the next medium term.
Mas importanteng tutukan talaga natin tong mental health. Napakaraming apektado ngayon panahon ng pandemya compared before. Can you explain the medicine access program for mental health? What commodities can be how can this program be assessed? Access, I mean.
Thank you, Mr. Chair. We'll provide you the list po of the commodities, but we have 25 first-line medications that can be provided at the community or parang at the primary care level right now that we procure nationally. Ang nangyayari po is the people who are assessed at the primary care level, whether that be through the barangay health workers or through the LGUs, if assessed, and yung mga treatment po nila are the ones that we purchase, they can have access to these medicines by also going through our specialty network. So nare-refer up, nada-diagnose po sila at the community level, nare-refer up, and then if necessary, the medicines are provided for.
Doon
But
sa mga RHU or pupunta po sila ng ano?
Sa RHUs po, yung talagang access po nila. And then it's the RHUs who
How
coordinate
about
with.
areas or provinces or regions na walang walang National Center for Mental Health? Kaya nga ngayon dadagdagan natin yung mga specialty center. I think yung DOH are planning to put up 20 or more National Center for Mental Health. I mean specialty center for health, no, across the country. So for example lang po, no, sa doon sa Zamboanga, kung wala sila malalayong lugar doon, nasa dulo, walang National Center for Mental Health doon, tapos pumunta sila doon sa rural health RHU ninyo. So paano po sila pag medyo malala yung case, anong ginagawa niyo po?
Mr. Chair, currently po we have 362 access sites po. So tama po kayo, we're still building the network. These access sites po comprise of RHUs, LGU hospitals, and TRC. So for example po, for Zamboanga, we have 3. Zamboanga City Medical Center, Dr. Jose Rizal Memorial Hospital, and even our own regional office of the CHD of the Zamboanga City. So ito pong temporarily identified na access sites, dun po sila nare-refer for treatment po.
Sige po. Salamat. Senator Win.
Thank you, Mr. Chair. Mr. Chair, just to follow up on your discussion, para tsaka maka-relax rin si Dr. Reyes. Si Dr. Domingo naman, no? Sa financing. Can you, in behalf of PhilHealth, no, what are the programs that we have for mental health?
Thank you, Mr. Chair. And as a prelude to my answer to the question, may I request the Secretariat to please display slide number 21? Just one slide, Mr. Chair. Yung pong mga programa ng PhilHealth sa ngayon para sa mental health, karamihan po, actually sa ngayon po lahat, correction, lahat ay pang inpatient. And in our opinion, that may already be too late. Suicides can be prevented, but we can save lives even outside before the hospital. Marami pong mga napag-usapan sa hearing na to, sa aming pong pakikinig, yung mga tanong po sa telemedicine, sa dami po ng mga tawag nationwide. At tama po kayo, Mr. Chair, na hindi natin nakaka-capture lahat kasi yun lang yung mga kayang tumawag, yung may telepono. Paano kung wala silang telepono? Narinig po natin ng butihing chair na nagtatanong tukol sa mga gamot. Paano kung walang RHU? Kanina po merong tanong tukol sa mga health card. Paano kung may private sector na provider pero hindi niya tinatanggap yung HMO card? Well, lahat po ng Pilipino ay may HMO. Ang tawag po doon PhilHealth. Yun po yung pinaka-national, kaya nga tayo National Health Insurance Program. And sorry, this is not the slide. Slide 21. Forward pa po. Forward. Forward. With the indulgence of the chair, this is very important. Forward. Forward. Yan po. This particular slide, yung pong parang drawing sa kaliwa, ayaw nating manatiling drawing lang. Dapat maging totoo siya. Yan po yung Healthcare Provider Network na sinasabi. Under Republic Act 11223 or the Universal Healthcare Act, which was signed by then President Rodrigo Roa Duterte, which President Marcos is now implementing. So this particular HCPN, yung pong NCMH is just one of the projected many specialist care centers, tertiary care yun nasa taas. And as correctly identified po, may issues po kasi talaga sa stigma eh. Yung sinasabi na, saan ka nanggaling? Pasintabi na po, no? It should not be the case, but the reality is nanggaling yan sa mental. Yung kasabihan na gano'n, no? Because the very facility is labeled a mental health facility. But what if ang mga kababayan natin ay pwedeng pumunta sa isang doktor na hindi alam kung ano yung disease, no? Hindi alam kung siya ay may TB, hindi alam kung siya ay may sakit sa mental health, hindi alam kung siya ay may concern. Ang tawag po natin doon is disease agnostic. Yun po yung sa baba, yung kulay green, primary care. Which is why the program of the Department of Health, which PhilHealth is supporting, is to strengthen primary care. Ang bawat, tawag po namin sa PhilHealth konsulta, ang bawat konsulta accredited provider, which is a primary care provider, dapat kaya niyang magbigay ng serbisyo. Hindi lang yung mga nakasanayan natin na TB dots, yung maternal and child care, kasama na rin dapat ang mental health. So for the update of the Honorable Committee, PhilHealth has, following the directives of the committee and of oversight, has been developing a mental health package, expanding it, na hindi lang tayo dun sa kulay gray, which is the 7,800 case rates para sa inpatient conditions, pero magkaroon na rin ng outpatient. Outpatient, well, the academics might actually remind me na meron kasing outpatient na tertiary care, merong outpatient na primary care. I use the term primary care po, Mr. Chair, loosely to also include yung outpatient dun po sa primary care sa kulay green sa mapa natin. Meron tayong general package para sa mga general practitioners, para sa mga family med. In fact, if you will look at the details po, which we can provide, of course, Mr. Chair, pati po ang mga barangay health worker magkakaroon ng training, pati ang mga midwife nurse, depending on the situation. But we rely on them to screen for the conditions. Yung pong sinasabi nalulungkot, na-depress, may kinakabahan, may anxiety, nakikita dapat yan sa primary care. Now, if they need specialist care services, they don't necessarily have to be admitted at the National Center for Mental Health. No. Under the plans, not just plans, under the actions of PhilHealth for this year, there will be a specialist care package which is also outpatient. Yun po yung maliit lang sa screen pero makikita po yan yung sa upper right na green na box. The target facilities that will be contracted include even level 2 hospitals and we are looking at compensating not just psychiatrists, neurologists but also psychologists. Bubukan na po yung pananaw ng PhilHealth na hindi lamang talaga doktor ang dapat binibigyan ng reimbursement kasi pagdating sa mental health, we can be ably assisted, of course, by our paramedicals, by our allied professionals, the psychologists. So, yun po. And now, going back to the issue, paano naman yung private sector? Well, PhilHealth as a strategic purchaser, we hope that it becomes enticing para pati po ang private sector natin ay sasama sa programang ito. We cannot require them, but in practice, since the establishment of the corporation, lalo na ngayon na tumataas yung benefits, mas nakikita nila na mas mabilis kausap ang PhilHealth, sinusubukan ng bilisan ang pagbayad. It's an ongoing process. But definitely, compared to HMOs, which are also our allies, the larger risk pool is PhilHealth. Yun po, Mr. Chair.
Thank you, Dr. Domingo. I have a few questions on your comments. No? Number one is the amount, no? 7,800 for inpatient. This is for 1 year? How is this utilized?
Yes, Mr. Chair. So the 7,800 is a case rate. It is for specific conditions, and it is only on a per confinement basis. I am not so familiar, but I think there's a single period of confinement. There's a rule on that, and also there are, I think, 45 days within which, if you get repeatedly admitted, PhilHealth would only pay for one episode. So it's an episodic payment, reimbursement po siya. Hindi pa ho siya yung parang for the whole year.
What if this is when you are already confined?
Yes, sir.
Correct. But what if you get a call, no, and then the person has suicidal issues. You want to see a doctor. You want to see mental health professionals. Can PhilHealth pay for those consultations?
The present gap, sir, is precisely that. Right now, we cannot pay, but
Correct. That's why
hopefully-
that's what I'm saying earlier.
Yes, sir.
Nasa crisis na tayo ngayon eh.
Opo.
But the government is not responding.
We aim to implement by
As
July.
early as
sir.
2020, we've seen cases already spike 4 times.
Yes, sir.
But the financing mechanism is not responding. So, saan pupunta ang tao natin ngayon? Saan pupunta kababayan natin ngayon?
Sir, ipagpaumanhin niyo po na medyo natagalan, but by July, after board approval, hopefully by June, this year po, in a few months, 2 months from now, this hearing, we hope to implement it, sir.
So, what will be implemented?
The mental health outpatient package, which will include the generalist care para po dun sa mga tulad nung call center, for example, or at primary care, kahit na walang call center, kahit sa RHU. And also the outpatient specialist package, which includes yung mga neurologists, psychologists, psychiatrists na not necessarily admitted yung pasyente.
So, they can go to any doctor, whether in public hospitals and private or the private sector.
So long as accredited po yung doktor.
Yeah, so long as accredited by, halos lahat naman yata accredited na ngayon eh.
Marami po ang proportion, malaki po.
Okay. And how much is the amount?
Right now, Mr. Chair, hindi ko pa ho masabi yung amount kasi it's still being deliberated by the actuary and the board po.
Because from our cursory research through the internet lang naman to, no? So, but these are just to give the body some estimates. For a 21 session for bipolar disorder, it will cost about 38,000. No? In one of the this is in Ateneo, and also for 21 session bipolar, this is for the, I think this is with the Philippine Mental Health Association, it's about 15,000. So what I'm driving at is the range is between 15 to maybe 38,000. So if we're looking at a 7,800, kulang talaga siya, no? So I want to put that figure ready on the table because you're coming out with a policy. In fact, too late na yung policy na yan eh. That policy should have been available as early as 2020, no? Because we saw the spike 2020. Nasa pandemic of mental health na tayo ngayon eh, no? Unlike during the pandemic, Senator Bongo knows this because he's the chair of our the budget of DOH. When the pandemic struck, talagang kinuha natin lahat ng pondo ng iba't ibang gobyerno. We shored up all the dividends, all the available cash from different GOCCs to fight the pandemic. But in this particular case, the mental health issue is already here, but we're not doing anything. It's only now lang, in the next 2 months, that we will be coming up with a financing mechanism for our constituents to use. So ang punto ko, even though they call the mental health center, they want to see a doctor, but they're poor, they cannot do anything. No? That's why it's not that's why I think the logic on why the suicide cases increased in 2020 by 2 times is because our poor constituents cannot seek professional help outside of a professional help outpatient modality. No? Wala silang available na modality for outpatient. And that's why I was also asking the DOH if they have dissected that 5,000 suicide cases, because I want to know if they went for treatment. I want to know if they went for professional help. I want to know if what type of treatment were available to them. without those information, we don't know what intervention programs we can provide to our poor constituents. That's what I'm driving at earlier. But it sounds logical that the suicide cases increase because there's no available outpatient treatment for our poor constituents. Yun ang aking analysis on what's happening right now. No, and I'm happy that PhilHealth is now addressing this, but I'm not happy that it's only now that PhilHealth is responding to this mental health pandemic. So I would hope that the PhilHealth is on stream, no, on time to release that package. And will that package be available to all PhilHealth members?
Yes, Mr. Chair. When we submitted the assumptions for our actuary to process, we looked at the data, the 3.6 million estimated people affected by mental health conditions. So yes, it is universal.
Okay, so it even though they're and let me just clarify, even though they go to a private doctor or a private clinic, that service is available to them.
That would be the challenge, Mr. Chair, because as you correctly pointed out, the range of costs is rather wide. You have a low end of, at least in your estimations, 15, high of 36. That's really, and natuhog niyo, Mr. Chair, doon talaga magkakaroon ng debate even internally sa amin kasi you will have those who are, of course, pushing for more benefits to go on the higher, but of course, those who are watching the financials will say, baka hindi natin kaya. So hopefully makuha natin.
Yeah, but my point there is let's be reasonable to our constituents, no? Because if you're talking about 7,800, that's not going to help anyone.
Definitely,
no?
yeah.
So I pointed out those costs out so that PhilHealth would be flagged, and let's be reasonable. No, the aim here is to reduce the number of incidences, because the number is going up. Pataas siya, and in the absence of a national aggregated data, I would assume even 2022 and 2023, the numbers are still pushing up. We're not doing anything. So I don't know how the numbers will go down without doing anything. No? So this intervention through PhilHealth can probably be the cure, to push down the incidences of suicides and the incidences of mental health.
Yes, Mr. Chair, and I'd also like to take this opportunity, baka nakikinig yung DBM saka DOF, kasi apart from the cure medically, ito rin ay isang cost-saving measure. Kapag maayos ang payment sa primary care, yung mas mahal na interventions, pasintabi po, na nasa specialty centers na kailangan rin namin bayaran, hopefully bababa. So it really makes not just medical and also public health sense, but also fiscal sense to fund primary care, including mental health.
I saw in the presentation of DOH that the strategy will be what you call the institutionalization, no? And I assume this is community-based intervention. Will the new program from PhilHealth be aligned with your community-based intervention? Because my initial thought when I saw your presentation, yes, it's good to decentralize or deinstitutionalize. It's good that you have community-based, but do you have the funding? If you don't have the funding, or our constituents will not have the funding, then it's only good in paper, but it's not going to happen on the ground. No?
Yeah, you're correct, Mr. Chair. So the intent really of this global strategy is to bring people back to their homes, to their communities, to their local governments. And that will really mean shifting now resources, or at least allocating more resources for primary care at for the health sector. But even po yung napag-usapan din po natin na schools, workplaces, but where they are generally at, putting the resources there to make sure that they don't need to be elevated in
And
the higher.
how can PhilHealth play a role in that deinstitutionalization and community-based? No, for example, I'm assuming lang, no, in a far-flung area, the only access there is a doctor or a psychiatrist or a mental health professional going there, no, to the far-flung area. Can PhilHealth be a tool for that constituent to access mental health professionals?
Yes, Mr. Chair, especially if the flexibilities are included in how they design the package. For example, flexibility for mobile services, telemedicine, and other outreach-related activities, provided that they have a home area that to go back to meet all of the other requirements of PhilHealth. But these are all possible po depending on the design.
And that will be available, telemedicine, yung, what you call that, mobile, no? The mobile mental health access, will that be part of the outpatient program?
Initially, Mr. Chair, the design does not yet include
Tama nyo
telemedicine.
na. Why don't you include
But
it?
if I may,
Yes,
Mr.
that's
Chair,
what our chairman mentioned earlier, telemedicine, no?
Right.
And
But
that's now using technology, because you don't have to go to, that's that's a very good program, because you don't have to physically go to a hospital.
yes.
No, everyone has a cell phone. You can use your Zoom. You can do telemedicine.
Fully agree, Mr. Chair, which is why, this is like me teaching constituents how to circumvent. No, it's not circumventing. The design will be for brick and mortar facilities, but the brick and mortar facilities can have their own telemedicine hotlines. So if they are going to bill PhilHealth in the guise of doing the service, which they should be doing, it's just a matter of using a technology to deliver the service.
There is, let's use technology.
Yes, Mr.
I
Chair,
think
definitely.
the age of using telemedicine is already here. In fact, even after the pandemic, I know a lot of people using telemedicine because it's convenient, it's better for our traffic. No? So let's make it more explicit in our new outpatient program. I truly see the wisdom on why doing the community base can help decongest all of our brick and mortar hospitals. No?
Fully agree, Mr. Chair.
All right. Thank you. And I really hope, well, I will monitor, and I will request PhilHealth to submit to us maybe an initial, if you have any initial documents on that new outpatient program, which is about time, will be more than, it will be more than welcome that you submit it to us, so we can review it, we can analyze it, and we can suggest, no, if there are other improvements that we can make. No?
Thank you, Mr. Chair. And maganda yung timing kasi hindi pa nagko-convene yung board on this.
Yeah.
Thank
All right.
you.
Thank you, Mr. Chairman.
Salamat. May follow-up question lang po ako. How many recovered patients po are still in the NCMH? At ilan sa kanila ang may pending cases na dapat pong ilipat na po sa BJMP? Nakagraduate na ba ito sa medication? At and I'm sure siguro bago nyo po ina-admit dyan. Curious lang ako, yung siyempre yung iba dito may mga cases na nakasaksak.
Yes, sir. All other criminal cases or petty theft, burglary, parricide, homicide, murder,
Pwedeng,
arson.
paano nyo ma-determine kung nagkukunwari lang silang may sira,
Yes, sir.
nasisiraan para lang hindi makulong?
Sir, there's a protocol being followed. Consistency of responses on the mental status examination. If that is the contention that they are suffering from a mental illness, then we will evaluate thoroughly, sir, in terms of neuropsychiatric screening test and some standard test. They come, sir, with a commitment order already, and I cannot do anything about it. And then our task is to certify whether they can stand or they are fit to stand the rigors of trial, meaning they can answer relevantly, coherently, they understand what is being accused of them or the case that is they are involved. Once we evaluate that they are ready, then we submit a certificate to or certificate to the court that they are ready to stand the trial or they are ready to be brought back to jail of origin. And your first question, Your Honor, is at present, sir, out of the 500 patients there, 176 are deemed competent to stand the rigors of trial, and yet they are.
Binabalik na sila sa BJMP.
We are trying to bring them back to the jail of origin.
Pero meron pa rin naiwan sa inyo
Nandun pa rin sila, sir, yeah.
hanggang ngayon kahit na pwede na silang ibalik sa BJMP.
Yes, sir.
Yung mga can we also ask the BJMP or the DOH how to address this concern involving inmates in Pavilion 4, no? And then, aside from that, itong DSWD naman po, pag wala na silang mapuntahan, graduate na sila sa National Center for Mental Health, saan sila pupunta kung wala na silang pamilyang pupuntahan? Meron ba tayong halfway house for this, na meron silang mapuntahan? Pero unahin muna natin itong sa case ng mga ano, dito sa nag-graduate na po ng mga may mga kaso.
Yes po. Good afternoon po, Mr. Chair. Yes po, regarding dun sa sinamang 176 pa po na who have been declared already competent by the experts of the NCMH, we have already written a request to the Department of Justice to assist us in having this already be given this commission order to be brought back to their respective BGMPs, and that yung to facilitate their transfer po. So we have been following up our request from the OJ, and still now we are waiting for the response po. And this will help a lot in decongesting that specific pavilion po where they are there right now. Thank you po.
DOJ, do you want to respond?
Good afternoon, Honorable Chair, Your Honor, co-attendees. We thank for first and foremost po, the Secretary of Justice wishes to express the appreciation for this invitation, and the Secretary welcomes this move to strengthen the implementation of the Mental Health Act. I come from the National Prosecution Service po. I've been sent here to represent the prosecution service, but earlier po, ASEC conferred with me regarding the specific concern about the patients who are already fit to be returned to their jail of origin. And I personally followed up with our office po, and the Secretary's office is going to prioritize this matter because as of now po, Your Honors and fellow attendees, please be informed that the Secretary of Justice has this move to, he's already pushing for the decongestion of jails. And once the jails are decongested, the project will also benefit po the movement from the mental health institutions and for all the causes that we could have to decongest the jails. It will benefit the community as a whole. So please be rest assured po that the Secretary of Justice will do everything to prioritize your request and also to do everything in the department's mandate to support and strengthen the implementation of the Mental Health Act po. Thank you po, Chair.
Salamat, no? Dito rin yung DSWD. Kasi para sa akin, tao rin ang mga to na kailangan ng bigyan ng atensyon after, lalong-lalo na po pag graduate nila. Bigyan natin sila tulungan natin sila. Huwag nating pabayaan, lalong-lalo na po pag nakalabas na sila sa National Center for Mental Health. May mag-aaruga sa kanila, mag-aasikaso. Dahil kawawa naman, wala na silang mauwiang pamilya. Kaya gusto kong itanong po ito sa ating DSWD, yung mga halfway houses po natin para sa kanila. Naka-experience na nga to ng depression, kaya pumasok dyan. Paglabas naman po, sino mag-aalaga sa kanila kung wala na po silang pamilyang mauwian?
Mr. Chair, good afternoon, Mr. Chair. From the DSWD, we'd like to inform you, Mr. Chair, that we have the centers, residential facilities that can cater to them. And we can also coordinate with the local government units to locate families if ever meron pong relative, hindi man po close na of parents, pero kung may relatives pa po na willing na mag-accommodate sa kanila, we can coordinate with them and for the reintegration or aftercare po ng ating mga graduate mental patients, Mr. Chair. aside from our residential facilities, if there are no relatives and nobody wants to take them back, even if they have relatives, they can be catered at our centers, Mr. Chair and Your Honors.
Salamat po, Ma'am Joy. How about Assistant Secretary Irene Dumlao? Naka-mute ka, yan. Smile, ma'am.
Wala.
Pakiulit lang po, ma'am. Hindi marinig. Sandali lang po. Wala pa rin.
Mr. Chair, magandang hapon. Yan. As clearly enunciated po by ASEC Janet, yes, the Department of Social Welfare and Development has our centers and residential care facilities that cater to abandoned, neglected individuals who might have undergone some challenges that might require or need specific interventions, especially on the aftercare. We also would like to mention, Mr. Chair, that the DSWD has actually implemented several projects and activities para po makatugon tayo sa pag-address ng mental health needs of the poor, vulnerable, and the marginalized. And Mr. Chair, we would like to take this opportunity to mention also that by utilizing the case management approach in implementing these programs, the DSWD has and continues to ensure yung pong holistic provision of interventions to clients, not only limited to financial assistance, but as well as psychosocial and social care, either by the department or through referral to respective agencies or institutions such as the NMCH. And gaya nga po ng nasabi ko, the DSWD has implemented various sectoral programs that include psychosocial support as an intervention that is provided to clients. Nandyan po yung ating strategic help desk for information, education, livelihood, and other developmental interventions against child labor, psychosocial care, and support services for people living with HIV and AIDS. And yung pong recovery and reintegration program for trafficked persons. Again, Mr. Chair, we'd just like to take this opportunity to mention yung pong mga iba pang mga programa ng DSWD that responds to mental health needs. We also have in our assistance to individuals in crisis situation, yung pong psychosocial and mental support services. And during natural disasters and other calamities, nagpo-provide din po ang department ng psychosocial support intervention. And the DSWD has also developed the wireless mental health and psychosocial support for to address yung psychosocial needs of different clientele groups in the new normal and other crisis situation. Aside from that, Mr. Chair, we are also leading in the formulation of social welfare programs and policies as our commitment to promoting the well-being of our personnel by ensuring that mental health is valued, promoted, and protected in our place. And Mr. Chair, we also would like to mention that the department continues to ensure that individuals and families affected by crisis situation, as well as persons with disabilities who have psychosocial and mental disabilities, receive the necessary support and care that they need. So patuloy po ang DSWD na magiging valuable partner po ng Department of Health and other stakeholders in promoting and protecting mental health in the country, Mr. Chair. Thank you very much for this opportunity.
Salamat po, ma'am. Let's now proceed sa DepEd, no? Bilisan na lang po natin konti. Medyo hapon na. May we now hear from DepEd, Ms. Jonah Kristen Valdez.
Good afternoon, Mr. Chair.
Hello,
Ayan,
ma'am.
so I'm, yes, good afternoon po. Asik
Ma'am,
Galban,
hindi kita nakikita sa screen. Si Ma'am Irene lang nakikita ko. Ma'am Jonah, paki-open ang screen mo.
yes, yes, sir. Ayan po.
Yan,
Good
yan.
afternoon po,
Smile,
Mr.
ma'am.
Chair. Yes.
Hmm.
Yes, ayan po. So thank you for this opportunity. The Department of Education appreciates this invitation, and we are fully supporting this initiative of the Senate bills presented. And as per this bureau, we are from the Bureau of Curriculum Development. We have two department memorandum released in 2021, which still we are still using this in our respective schools. We have the department memorandum number 359 series of 2021 on counseling and referral system of learners. This covers protocols on counseling, referral of learners to other professionals or institutions, and procedure in managing suicidal situation based on the World Health Organization. This is based on the specific provision of the IRR of R.A. 11036, which is the section 25, which mandates educational institutions such as schools, colleges, universities, and technical schools to develop policies and programs for students, educators, and other employees designed to raise awareness on mental health issues, identify and provide support services for individual at risk, and facilitate access, including referral mechanisms of individual with mental health conditions to treatment and psychosocial support. Also, based on the Section 24 of the said IRR, the integration of mental health into the educational system, we have released or we have issued Department Memorandum 346 series of 2021, which is the homeroom guidance during crisis situations. So this program is relevant as it promotes rational thinking, healthy behavior, and positive disposition. So issues like academic failure, school dropouts, bullying, unhealthy sexual behavior, teenage pregnancy, drug addiction, online and social media addiction, and confusion in poor career choice and other challenges that beset our learners today were considered in developing the program. Your Honor, this is a preventive program and part of the information services of the guidance and counseling services. Thank you.
Salamat po, ma'am. I also support strengthening mental health services no in basic education schools. I co-authored Senate Bill 379 if Senator Win Gatchalian. Ito po yung na-file mo rin no na to address mental health issues of the youth no dahil na balitaan nga natin dami pong nag-commit nga po ng suicide, nagkakaroon po ng depression. Nababahala tayo sa mga reports na ganito sa murang edad po experience sila ng depression. Dapat po nating tutukan po ito. Now, how are we equipping and capacitating our teachers and parents po in dealing with the mental health issues? Follow-up question lang po kay Miss Jonah Valdez, DepEd.
Ayan. Thank you po, Your Honor. We have partnership po with other organizations in equipping our teachers and guidance counselors in the delivery of our mental health services. Currently, we are in transition po in this implementation together with the governance under the leadership of ASEC Galban. We are currently crafting the mental health protocols or the department order on how we are going to have the training, advocacy, and capacity building for our guidance counselors and teachers. That is in collaboration with the governance strand.
Naputol. Anyway, sa CHED naman, Miss Yuri Castro. Online yung CHED, ComSec. Sa CHED. Kung wala, please submit your position paper na lang po. Anyway, I have filed the Senate Bill 1786, no, which mandates public higher education institutions to establish mental health offices, including the hiring, deployment, and training of additional mental health service personnel. Kung wala pa po ang CHED, let's now proceed to TESDA.
Good afternoon, Mr. Chair and the member of the Senate Committee on Health and Demography. Good afternoon po.
Sir,
Yeah, good afternoon.
go ahead, Sir Noel
Yeah.
Cuevas.
Okay. TESDA expresses its full support to the proposed amendments of Republic Act number 11036, otherwise known as the Mental Health Act, and is objective to make mental health care services more accessible to the public through the increase of the case rate package offered by PhilHealth and its inclusion to the provision of free mental health care services to the following: minors, victims of domestic violence, trafficking, and the homeless, by empowering them and ensuring that their mental health is valued, promoted, and protected. We would like also to inform the Honorable Committee that the agency has taken the initiative to implement Republic Act 11036 through integration of age-appropriate content and creation of guidelines and standards pertaining to mental health in vocational and training programs for both public and private vocational education institutions administered by trained and mental health service provider. Additionally, TESDA has implemented mental health-related programs and activities for its employees through the basic occupational safety and health training, which discusses mental health awareness and ways to manage stress in the workplace. Likewise, TESDA also offers mental health peer support training for employees, which features mental health orientation, mechanism for peer support groups, and how to facilitate peer support. That's all, Mr. Chair.
Salamat po, Mr. Noel Cuevas. May we now hear from Dole, Dr. Maria Beatriz Villanueva. Diyan ba? If wala po, kindly submit your position paper na lang. Punta po tayo sa Civil Service Commission Attorney Crunimar Escudero III. Sir.
Good afternoon po, Senators. With respect to Civil Service Commission, Your Honor, pursuant to the mandate of the law, Section 35, and the IRR of the law, for CSC to craft policies, to issue policies and standards on the mental health program in the workplace, the CSC issued MC number 4 series of 2020. This was in February 2020, providing guidelines on the mental health program in public sector workplaces. And these guidelines, no, the good part of these guidelines is that we have provided a model policy for agencies to implement their own mental health programs in their respective workplaces. Aside from the policy, Mr. Chair, we also conduct learning and development interventions. In fact, we have already covered 10 regions since the issuance of the mental health policy in public sector workplaces. And we had around 1,500 plus participants consisting of HR managers and agency heads, and also including rank and file employees. also in coordination with DOH, we conducted a town hall meeting in around April 2022, participated in by around 6,000 participants. And just recently, or on August 28, Your Honor, we together again with the DOH and Department of Labor and Employment, we launched the policy framework on healthy and safe workplaces. And the mental health, of course, component is an integral part of the framework, considering that without health is really nothing without mental health. As far as the CSC is concerned, Your Honor, these are the initiatives, these are the activities we have engaged in the implementation of the Mental Health Act. So, Mr. Chair, we would just like to read on record our position on the bills, as to Senate Bill number 920. We differ, because this talks about funding. We defer to the Department of Budget and Management. As to SBN Senate Bill 1717, since there is a provision that there will be created offices, we would just like to put on record that if there are offices that would be created, then sana po these offices will refer to our 2017 Omnibus Rules on Appointments and other human resource actions in the creation of plantilla positions. With that, Mr. Chair, we will submit our formal position paper, and we will incorporate our report on the implementation of the Mental Health Act. Thank you, Mr. Chair.
Salamat, Attorney Escudero. May we now hear from DILG Attorney Gino Lavarias.
Good afternoon, Mr. Chair. Good afternoon, Senator Gatchalian. I would just like to say the updates of the DILG on the implementation of the Mental Health Act. In response to the memorandum circular of the CSC, the DILG has developed its own mental health workplace policy. The DILG provides mental and psychosocial support services to its attached agencies like PNP and BJMP personnel, which includes persons deprived of liberty in areas affected by armed conflict. And the LGUs were informed and oriented on the mental health law through the leagues of cities, municipalities, provinces, and barangays. The DILG also provided the joint memorandum circular, the draft joint memorandum circular to the DOH on guidelines to establish mental health program on the local level. With regard to the subject legislative measure, the DILG supports the subject legislative measure because it expands the coverage of the mental and behavioral benefit package provided under the mental health law. That's all, Your Honor.
Salamat po, Attorney Gino. May we now hear from CHR, Attorney Gemma Paroinog.
Good afternoon, Mr. Chair.
Go ahead po, ma'am.
Okay, thank you, Mr. Chair. On the part of the CHR, we have already sent our letter of support to the two bills that are covered for this agenda. Actually, there's just one comment that we would like to raise with respect to Senate Bill 1717. We would like to raise the issue of recognizing the mature minor doctrine that we have adopted with respect to the Philippine HIV/AIDS Act. Karamihan po kasi ng mga bata ngayon ay hindi kaagad-agad nagsasabi sa mga magulang. So binibigyan natin sila ng karampatang pagkakataon na mag-consult din sa mga professionals na available, accessible sa mga eskwelahan at sa mga community. Yun po yung gusto natin may sama sana doon sa Senate Bill 177. In addition, with respect to the implementation of the Mental Health Act, the CHR po is part of the Philippine Council for Mental Health and actively sits in the development of policies on the implementation of the Mental Health Act. Kasama dyan yung pong mandato ng CHR to conduct visits independently of the Mental Health Act. Kasi po sa mandato ng CHR, meron po kaming opportunity to visit mga mental health facilities. At for the information of the body, noong pong pandemic around 2021 and 2022, nagkaroon po ng pagbisita ang CHR sa mga ilang mental health hospitals and rehabilitation centers. At sa aming pagbisita, ang mga findings po na nakuha namin, unang-una, wala pong nakuhang recorded torture or reported torture, but it seems we have noted incidents of inhumane treatment given the conditions that we've seen in some mental health facilities. Again, this is nationwide. This is not specifically on National Center of Mental Health, but we do acknowledge that there was limited access to sunlight on the part of the patients, limited access to clean water, insufficient use of electricity, need for secure and electronic database. In some facilities, there's lack of privacy in bathrooms. In one facility, there's no NDA among its employee to secure confidentiality, non-disclosure agreement. And then there's insufficient beddings and blankets in some of the facilities and cases of abandoned service users. Karamihan dito na pag-usapan natin ngayon at kino-confirm namin that not only in NCMH but in some facilities nationwide, we have noted that. For example, in Camarines Sur, in one facility there's test in water quality and so far nag-fail po sila sa water quality test. So yun po yung mga findings ng CHR at we have given these findings to the administrator of the facilities, and we are coordinating with them to ensure that necessary measures are provided to address these issues. So in addition to that, ang CHR po, as part of the implementation of the Mental Health Act, we have conducted our own mental health awareness raising. There was a series of webinars during the pandemic for our own personnel here at the CHR. We have also conducted capacity building because as part of the IRB, which is a mandate given to us by the Mental Health Act, we have to capacitate certain officials of the CHR to act as an internal review board who will also conduct visits on the part of visits to the facility. Yun po yung ating piniprepare ngayon. We wanted to ensure that our employees at the CHR are capacitated. So actually in June first week, we have a training of trainers, Mental Health Act 101, emphasizing on the right to health and then mental health, so that we know our officials are capacitated to point out the necessary issues with respect to mental health as provided in this law. And then, of course, we have conducted a survey with respect to perspective of the general public on the right to health and mental health. And then we have identified issues of stigma in certain areas of the country. So we are trying to address that as well. So we're giving out lectures on the right to health and mental health and the fact that it's okay not to be okay, and it's high time that people speak out about their concerns. So we're doing all that, and so yun lang po muna for the meantime. We will submit as well position papers for the bills that were sent to us this morning, and also position papers on the bills that were given to us initially for this meeting, sir.
Salamat, Ma'am Gemma. We will now hear the updates and inputs from our stakeholders. First is from the Union of Local Authorities of the Philippines, Mr. Lawrence Trinidad, sir. Since wala na po, kindly submit your position paper. Next is from Philippine Psychiatric Association, Dr. Robert Benaventura.
Good afternoon, Your Honor.
Ay, ma'am. Sorry po.
Sorry, on behalf of Dr. Bonaventura, who is currently online, I'll be presenting our position statements. So good afternoon, Your Honor. Good afternoon, Senator Win Gatchalian. We from the Philippine Psychiatric Association, we are a private medical association, and we are a specialty society of the Philippine Medical Association, and we are composed of board-certified psychiatrists who are qualified to practice psychiatry here in the Philippines. So first, I will give our position statement on Senate Bill number 920, introduced by Senator Sonny Angara. So our PPA position statement on this Senate Bill number 920, the Philippine Psychiatric Association supports the Senate Bill number 920. However, the feasibility and practicality of including psychotherapy sessions or talk therapy sessions is improbable, given that it is specialized and should be tailored for each patient. And there's a scarcity of mental health professionals per se in our country. And this is an important factor to consider. And thus, this is one of our recommendations, in fact, is to hopefully entice more doctors and mental health professionals to join the fold. And this is our advocacy really, to bring more people to help us in our advocacy in helping raise awareness on mental health and fulfill our roles and duties to help in the implementation as well of the mental health law. For our position statement on Senate Bill number 1717, introduced by Senator Amy Marcos, our position, the Philippine Psychiatric Association strongly supports Senate Bill number 1717. Thank you.
Salamat, ma'am. Malaking bagay po yung Philippine Psychiatric Association dito
Yes.
sa ating mental health issue. Malaking tulong po kayo sa issue na to, ma'am. Tulungan po natin, lalong-lalo na po yung mga mahihirap po, ma'am, na walang matakbuhan, yung mga helpless, mga hopeless, na walang matakbuhan kung hindi. Kayo po, tayo po na nandirito. Salamat po.
Maraming salamat po, Your Honor. In fact po, just to add to what Senator Win Gatchalian mentioned earlier, we agree kasi we are again a private medical organization. Suicide is preventable, and there's so much that we can do about this. And the numbers presented are numbers, and we know that there are people behind these numbers. And so that's why for us, it's unacceptable to have one mortality or morbidity from any form of self-harm or completed suicide or death by suicide. So kami po on our part, the Philippine Psychiatric Association has always been partnering, collaborating. We collaborate with everyone, all agencies like the Association of the Psychologists, guidance counselors. We also do mental health awareness talks for other government agencies, offices, for both government and private sectors, as well as collaboration with other medical societies, for everyone to really work together for us to fight the stigma surrounding mental health.
Salamat, Dr. Joanne May Perez Rifaril.
Thank you, Your Honor.
Salamat, ma'am. Next is from Psychological Association of the Philippines, Dr. Nino Jose Mateo.
Thank you and good afternoon, Mr. Chair and Senator Gatchalian. We support all initiatives to improve on the Mental Health Act, but we also would like to give emphasis on not only on the interventions. I believe most of the initiatives to revise is on interventions. But we also would like to to emphasize on the promotion of well-being and also on prevention. I think one of the things that was mentioned earlier, one of the bigger concerns is really on manpower. We really lack mental health practitioners in the field. We would like to put forward that we hope that we could capitalize on equipping programs in the undergraduate degrees, psychology, human services, even social work, to incorporate capacities for addressing well-being and well-being promotions, and so that they can be maximized to become mental health workers. We also would like to hopefully work with government in relation to providing plantilla positions for psychometricians and also to increase and to upgrade psychologists in government. Until now, the psychologists who are registered and who have a master's degree are only receiving salaries equivalent to that of a bachelor's degree holder. And that's also one reason why we have a lack of psychologists. And also, there are no psychometricians, plantilla positions in government, and we are working with Civil Service Commission on this. But that would really pave the way for really ensuring that a lot of people will be working and will benefit on mental health programs and promotions. One of the other things that we heard from the ground is that hopefully we could have a more centralized office in relation to the responsible department in relation to mental health and well-being, promotion of mental health and well-being. We have the DOLE, the DOH. We also have the DepEd. But sometimes there's something is lost in the translation. And when there is a need from the ground with regards to mental health promotion and also interventions, there's some difficulty in being able to communicate that with the responsible department. Apart from that, lastly, we would like to advocate also for the alignment of our programs with the World Health Organization, comprehensive mental health programs. Hopefully, we can have also a universal integrated mental health program for our country. Thank you very much.
Salamat, Dr. Nino. Malaking tulong rin po kayo sa ating problema ngayon about mental health. From Philippine Mental Health Association, Ms. Carolina Raico, may we hear your position, ma'am? Naka-log out na po. Just submit your position paper. And then from Alliance of Filipino Families for Mental Health, Ms. Sally Domino Bongga Lonta. Mag-anak ko to.
Hi, good afternoon to everyone, and thank you for this opportunity for us to be heard today. We have heard problems have been presented and more complicated now. We need to discuss ideas to go to the root cause solution. So let justice serve to those found guilty of charges, but I believe in the 5 pillars of justice. Hope we can reform the offenders and bring them back to society as new men and help us in nation building. We worked with people at the NSMH when we had our day center there from 2013 to 2017. I would say we were able to get our simple services in place because of the support of employees, despite the conditions they were in. We will work with you, our senators, with Dr. Gemma Parohinog of CHR, and with the SWD who has been extending us with livelihood assistance program, and with everyone, but we have to act now. Our position paper have been submitted in what we're doing now, the Care Farm project in communities, and we hope to discuss this further given the chance. Thank you very much.
Salamat po. From World Association of Psychosocial Rehabilitation, Ms. Lucita S. Lasso.
Good afternoon. Can you hear me, please? Yeah. We're a latecomer, late inviting. In fact, I'm almost a gate crasher, but nonetheless, we are very pleased to participate in this hearing. However, we will be submitting our position paper. I just want to address three important points here, which we will include in the position paper. One, I think while there is great demand for services, mental health services, in all parts of the country practically, we need to take a look at how we can respond to it and make the response proportionate to the scale of the demand. Ang isa pong crisis natin ngayon is yung mental health workforce. I think there's been mention of the shortage of guidance counselors, psychologists, psychiatrists. I think we have to have dedicated thinking on this issue. Number two, napansin po namin na sa kasalukuyang kalakaran, ang mental health at saka substance abuse are treated separately in the Department of Health. Can we think about integrating them? Because substance abusers are also suffering from mental health issues. In other countries, you have a department called Department of Mental Health and Substance Abuse, the SAMHSA, sa Amerika. Now, we probably can consider that as a long-term issue that we can address because it has structural implications and also budgetary implications. Pangatlo, gusto po naming sabihin na sana ay bigyan ng katapat na suporta ang research and information. Kasi sa pakikinig ko kanina kay Senator Gatchalian, tila ang kulang natin is we need more mental health intelligence, which means analyzing data. Because data are just numbers, but their meanings will have to be extracted based on our analysis. And so I think we need support in that. That's very basic. Bago natin malaman, makapagawa ng mga solusyon, we have to have a better understanding, like knowing ano bang age groups, anong age cohorts ang apektado ng suicidal tendencies. Saang region ba ng bansa karaniwan nangyayari yan? Because I think it will have programming and budgetary implications. Diyan na lang po muna, and we will incorporate our position, our recommendations in our paper. We are collecting the recommendations from the board, from our board members, and we will put them all together and submit it to the committee. Marami pong salamat sa pagkakataong ito.
Salamat po, Ma'am Lucita. Are there any other concerns and questions? But before we wind up, meron na po akong tanong sa DTI. The mental health law also considered the rehabilitation of persons suffering from addiction, mainly involving substance abuse. Gusto ko lang pong isingit, aside from our efforts to make mental health services accessible, is the DOH taking a firm stance against addictive products in the market such as vapes, no? And e-cigarettes, sino pong nanghuli? At since naipasa na po natin dito na nasa DTI na po ang pagre-regulate, I'd like to ask questions lang po sa DTI, yung marketing, selling, and use of vape and e-cigarettes. Paano nyo po ito monitor? Paano nyo po ito nahuhuli? Sino po ang may responsibilidad na magbantay po sa mga nagbe-vape po sa mga prohibited areas? Kasi ako mismo, napansin ko na marami pong nagbe-vape sa mga lugar na bawal, sa tingin kong bawal. Naamoy ko kung hindi ka naninigarilyo, hindi ka nagbe-vape, maamoy mo talaga. So nagugulat ako even sa mga gym or even coliseum na maraming katabi. Naamoy ko yung amoy, may amoy talaga. Hindi amoy kahit anong gawin mo, amoy sigarilyo talaga. Mabaho talaga. Maamoy mo yung, kung hindi ka naninigarilyo, hindi ka nagbe-vape, maamoy mo talaga, ano ba to? May parang usok sa tabi mo. So ano na pong update sa DTI kung paano nyo po nare-regulate, meron ba kayong, alam mo, may batas tayo na dapat natin na sundin. So, sundin natin yung batas. Paano nyo po nare-regulate sa ngayon?
Thank you, Mr. Chair. Good afternoon, Senator Gatchalian. Good afternoon. The DTI Fair Trade Enforcement Bureau, as well as the Regional Operations Group, is actually the one enforcing the provisions of the vape law. Now, we understand that the vape law has a transitory period, and the transitory period would end about June 2024. However, the DTI identified provisions that are immediately executory, and these are the provisions that the Fair Trade Enforcement Bureau and as well as the Regional Operations Group are enforcing at the moment. Now, since as of April, we have resulting 716 firms monitored. We have issued 95 notices of violations. We have issued 55 show cause orders, as well as confiscated around 9,999 products. For online, we have also monitored 17,426 firms and issued 17,357 show cause orders. For the Fair Trade Enforcement Bureau, as well as my bureau, the Consumer Policy and Advocacy Bureau, we have coordinated with online platforms also for the takedown of pages of online sellers, and which they have complied with, Mr. Chair.
Yun po yung selling, no? How about yung mismong na nag-hit ng vape dun sa public places, yung kawawa naman yung katabi niya na kung sa halimbawa may hika, naamoy niya yung amoy o yung sabi nila usok, o parang may usok pa rin, may baho baka maapektuhan naman po yung health ng katabi niya na gusto lang po mabuhay lang po ng tahimik at walang naamoy na mabaho. Ano yung enforcement niyo rito?
Yes, Mr. Chair, thank you. The use of vape in public places, especially indoor public places, is absolutely prohibited as specified in Section 15. And so the DTI will also enforce this, is also enforcing this provision. So if ever we catch someone using the vape products in indoor public places, they are also authorized to enforce the law. For the private places, they are also required to have designated vaping areas, because we note that in the definition of a designated vaping area, it does not distinguish between a public or a private indoor place. So we are requesting them to comply with the provision on the standards of designated vaping areas for indoor private places.
Yun lang po, ang importante dito ma-implement po yung batas, no? Para naman po sa mga kababayan nating, sabi ko nga, gusto lang po mamuhay ng tahimik at hindi maapektuhan. Dapat po walang exemption dito. Kung sino yung nagbabiolate, dapat pong hulihin. Tinanong ko nga yung staff ko kanina, meron pa bang nagbe-vape sa kanila? Dahil sabi ko, dapat po hulihin ko sa public places, bawal talaga.
Chair.
Go ahead,
Yeah,
Senator.
Mr. Chair, before we terminate the hearing, I would like to flash one slide, one graph, just to give the body the sense of gravity that our country is encountering insofar as mental health is concerned. These are the numbers that I mentioned earlier. If you look at 2019, and this is again, no, from the fan page or from the Facebook page of DOH. I think the source of this is from the National Center for Mental Health. These are the number of calls that were received by the center. So in 2019, if you look at the numbers, there are about 3,125 calls received, of which 700 were suicide-related. But in the same year, there were about 2,800 recorded suicides by the Philippine Statistics Authority. In 2020, this is COVID year, you see the number of calls almost tripled from 3,000 to 11,000. And consequently, the suicide-related cases also almost quadrupled in terms of numbers from 700 to 2,800. Unfortunately, the number of suicide also doubled from 2,800 to 4,400. In 2021, another COVID year, the number of calls still increased from 11,000 to 14,000, and the number of suicide-related calls from 2,800 to 5,000, double, but almost close to about 7 times from 2019. So you can see, Mr. Chair, that we are already in a pandemic of mental health. No, we should already sound the alarm bells. I think no amount of numbers should scare us because we're already in the danger zone when it comes to mental health. In 2020, 4,400 people committed suicide. No? 4,000, parang maliit na barangay na ho yan. Ng buong barangay nagpakamatay ho. No? Mr. Chair, I thank the committee and the chairman for holding this hearing because government is not doing anything. Fortunately, wala tayong ginagawa. No? And I am happy but also sad to hear that only this year that PhilHealth will come out with a outpatient financing program. For me, that's a game changer because that will enable our poor constituents of access to even private doctors. So, Mr. Chair, that goes to show that the country should do more in terms of reversing this trend. No, we're not doing anything. That's the bottom line. And that's why I implore the DOH, of course, PhilHealth to do everything it can to not only to implement the law, but to care for our constituents. Implementing the law, showing us the slides, of course, masaya kami makita yon kasi colored pa. No, but we're not physically doing anything. The government doesn't care. No? So hopefully this hearing will turn around things and will open up the eyes of everyone, most especially the DOH, because the DOH is the primary government agency responsible for implementing the mental health law. So, Mr. Chair, thank you very much.
Salamat po, Senator Gatchalian. One last question na lang po sa DOH, no? As we all know that COVID-19 take a toll on the mental health of many people. There are reports of a rising COVID-19 cases in the country. Kahit na po nag-decide na po ang WHO to end the COVID-19 bilang global health emergency. Meron pa rin nababalitaan nga natin, no, na tumataas talaga yung cases. I want to ask the DOH to update us on the current COVID-19 situation. Ano bang plano natin ngayon ng DOH kung patuloy pa rin tayo sa ating direksyon papaluwag at yun naman ang ating ninanais, no, na makabalik na tayo unti-unti sa ating normal na pamumuhay katulad po noon. Ano pong treatment natin dito sa COVID-19?
Thank you, Mr. Chair. So for COVID-19 po, you're correct. We're seeing some increase in cases in different parts of the country. But in our assessment, mostly this has not translated to admissions. They remain to be mild, and very few pa rin po ang ating severe and critical cases. So with that po, we, in continuing to welcome opening the economy, we just really want to stress the importance of having the different layers of protection. One of which is, of course, vaccination, yung lalo na yung pagkakaroon ng booster, whether it be the first or the second booster to all. And yung pagsusuot po ng masks, especially of those that are of highest risk, such as senior citizens, immunocompromised, and healthcare workers. So yung global discussion po on lifting the public health emergency really indicated three main things po kasi, no? At the global level, they saw that it's not anymore an extraordinary event, that the risks for international spread have already have some control, and yung coordinated international response is not necessary anymore, and that has led to their decision po. So these have already been discussed at the level of the IATF, and currently po ay i-forward na rin po yung discussions ng implications nito for the information din po of our president. So the DOH is reviewing all of the relevant aspects po for now. That's all po.
Salamat po. As chairman po ng Committee on Health, kung hindi naman po sagabal sa parte natin, magsuot pa rin tayo ng face mask. Hindi natin alam kung sino yung may dala ng sakit sa pamamahay natin. Kung hindi naman po sagabal, at ini-encourage ko talaga sa pag-iikot ko na magpabakuna para mas protektado. At yun po ang tanging susi o solusyon para unti-unti na tayong makabalik sa ating normal na pamumuhay. On that note, we thank all resource persons for attending this hearing and sharing your insights. Meron lang po akong closing statement. We should exert extra effort to ensure that the objectives and goals of mental health law are attained. We have encountered several challenges during the pandemic, but it has also shown us the weaknesses and gaps that we need to address. Bigyan natin ng importansya ang mental health kagaya ng physical health, alisin ang stigma at huwag nating hayaang ma-discriminate ang may mga mental health disorders. The National Center for Mental Health, which is the premier training and research center for mental health, should take the lead and ensure that the patients under its care are well taken care of and are afforded basic human decency. We are fully supportive of the implementation of the mental health law. That is why we are consistent in adding budget for mental health programs. As ako po bilang chairman ng Committee on Health and vice chair po ng Committee on Finance, consistent po tayo in adding budget for the mental health programs. And we are advocating the establishment of specialty centers in DOH hospitals. In fact, meron na po akong pinapapirmahang committee report. I-sponsor ko na po ito sa floor, itong specialty center. Kasama na dito ang mental health centers. Importante po ang suporta natin sa may mga mental health disorders dahil tao din po sila, kailangan nila ng pag-aaruga at pagmamahal. Ibigay natin sa kanila what is due to them, itrato natin sila bilang isang tao, pakainin natin sila ng maayos, bigyan ng makataong pangangailangan. Sa totoo lang po, marami sa kanila ang mabigat po ang dinadala at kulang po sa aruga at pagmamahal. Kaya naman iparamdam natin sa kanila na may nagmamahal po sa kanila at hindi sila nag-iisa. Nandito tayo para suportahan po sila. Ang bottom line dito ay kailangan nating ilapit po ang serbisyo sa tao. Ilapit natin ang access sa mental health services. It is important to improve accessibility, affordability, and availability of mental health services. Much has to be done and we will continue to monitor the progress of the implementation of the mental health law. Maraming salamat po sa inyong oras, mga resource persons. Salamat at magandang hapon. Thank you. This hearing is hereby suspended.